Good morning, everybody. This is Dawn Miller with the Healthcare Authority, Division of Behavioral Health and Recovery. I have Darren Paskey and Paul Ferris with me, and you're in the first part of the Supported Employment Fidelity Reviewer training. And so I hope you're in the right place. Thank you for being here. And please know that if you have questions as you go, you can use the chat box. We can unmute you if you raise your hand. There are a variety of options for being able to ask questions. With that, I'm going to turn it over to Darren if he wants to introduce himself, and then Paul to do the presentation.
Thanks, Don. Hi, my name's Darren Paskey. I'm the Supportive Employment Program Manager for Western Washington with the Healthcare Authority. And welcome everybody, because this is the first step to really broaden your horizons and learn more about the Fidelity Scale. And by some of the attendees today, some of you will be put right to work later this year in terms of actually being on part of a review. So definitely take some great notes during this presentation with Paul. Thank you.
Okay, great. Thanks, Dawn. Thanks, Darren. And just by way of introduction, I wanted to make sure I introduced myself to folks. So my name is Paul Ferris. So I'm here today with Dawn and Darren. I'm here courtesy of Public Consulting Group, which is an organization that has been working with Washington State Healthcare Authority to kind of provide the foundation of IPS supported employment services as we start to ramp them up in the state of Washington. So we're a couple years into it, and I've been working with Dawn and Darren for a while now. And the reason we're all here today is because we are here to go over, it's a 2-day training. So day one today, we're going to talk about the Fidelity Scale, as Darren said, and then tomorrow we'll talk about the process for fidelity reviews. So if you're here today and you're listening to me talk, you are working for an organization who has identified you as someone who could potentially become a fidelity reviewer in the state of Washington for IPS providers. So that would mean at some point, Dawn or Darren, or maybe some other folks would send you an email or call you and say, we have an organization in your area that needs to have a fidelity review, and you're the person that's going to be on the fidelity review team. So hopefully, by the end of our 2-day training, I don't know if I can sit and promise you that you'll know everything there is to know about fidelity reviewing. That seems pretty ambitious, but you'll at least have a familiarity with what you'll be scoring and how you'll be scoring it, so that maybe with a little additional observation opportunities, you can consider yourself a fidelity reviewer for the state of Washington. At least I think that's all the way it's going, and Dawn and Darren can chime in if I'm off base there. But yeah, the idea is that you're here to learn about fidelity reviewing as a fidelity reviewer, not as an IPS provider necessarily. And so a couple things just format-wise today. This is a long haul today for a virtual training. So we've got several hours here together. So I'm going to try to build in some breaks. And Dawn and Darren, refresh my memory. I feel like it's been a while since we've done one of these. Will we be taking like a brief lunch period during our training today?
We will.
We will. Okay.
We will
so
at noon or thereabouts.
Okay.
And I wanted to
fair
mention too, Paul, when we talk about fidelity review teams, in the case of what we're doing at this point in time in Washington State, if you're on a team, either Darren or myself will be the lead reviewer. So you wouldn't be doing any fidelity reviewing on your own. We're there to mentor. We're there. It's a learning collaborative process. So anybody that would end up being part of a fidelity review is going to be part of a team, and we'll work together. The other thing is we're still incentivizing agencies to participate in that. And so your agency would need to have a contract in order for you to be called upon to do a fidelity review. So just a couple of extra things.
Yeah, no, that's good. That's good context. I appreciate it. That's the stuff I can't help with, Dawn. Thank you. Let's see. So I will be taking breaks. We will be having a lunch. And so the way I'll do that is I'll just kind of talk for a bit. I'll kind of suggest a break. And if people don't want one at any point, certainly get into the chat and let us know that, you know, you're not interested in taking a break, and just like we would if it was face to face, right? On the break, that is your time. Do whatever you need to do. You know, if you want to do some more research into IPS, that's great. If you want to, you know, use the facilities and get yourself a little something to eat and refill your coffee or your water, that's all fine and dandy too. And I also know that everybody's busy, so if with the virtual format here, if you know something's going on in your organization that absolutely needs your attention, go do that. You know, we're all providers that work with people, so don't feel like you absolutely cannot leave this training. But if you do and you miss a significant chunk of it, I would encourage you to reach out to Dawn or Darren at a minimum to try to put back, you know, the information that you might have missed out on. Another thing, just so everybody knows, it's worth noting here, if we were face-to-face, we'd all be going around the room and introducing ourselves and talking a little bit, getting to know each other a little bit. We'd talk about, you know, where's the appropriate place to park and, you know, what happens if there's a fire. But since we're all doing this virtually, we're going to skip most of that. What I am going to do, though, and this will help us test either the chat or the questions box, I'm going to have you all just sort of chime in with your name, your organization that you're representing on this call today, and have you describe your first job and how you got it. And I'll kind of start. I know I already introduced myself. So I talked about I'm coming to you as of you know, from Public Consulting Group, and I do that in my quote unquote spare time, whenever that is. When I'm not doing that, I work at a community mental health center in Illinois, right on the border of Illinois and Iowa, called Robert Young Center. And yes, it's named after Robert Young, the actor, and that's a long story I'll tell you on break maybe. And so at Robert Young Center, we have IPS services, as you might imagine. I've been an IPS supervisor, and now I'm in a leadership role where IPS supervisors report to me. So that's my full-time job. When I'm not doing that, I work for the state of Illinois as a certified Illinois IPS Fidelity Reviewer, and we go around the state just like we talked about earlier, and we review other programs that offer IPS services, and we try to kind of give them a feel for where they're at with regards to the Fidelity Scale with IPS. So my first job, I always give two answers here. Rebecca, by the way, your question, where can I find the chat box? You're in it, so just keep in this area if you want to throw questions or anything there. I have two kind of first jobs. The first job I really had was working for my father. He was self-employed my entire life. He's retired now, but he operated like a silkscreen apparel business. So he did t-shirts and jackets and stuff like that. And so single digits, you know, 6 years old, 5 years old, I was folding shirts coming off of the dryer in our basement. And I always tell people, if you think your job's bad, try working for my father. The pay wasn't great, the hours were terrible, and basically I got meals for working for him, which is fine, I guess, in the long run. My first real job outside of my own family, I worked at the mall in a store called Wilson's, and I was a leather expert selling leather coats, probably overpriced leather coats, to the community. So that's my story, and I'm sticking to it. Dwayne here said, let's see, IKRON, is that Icron? And my first job was washing dishes. All right, dishwashers unite, right? And I've done that. Erica from Quality Behavioral Health, she's a certified peer counselor and an FCS provider. Great. We've got Holly from Harborview Mental Health and Addictions. First job was at Safeway. And it looks like she attended a hiring event. That's a really good way to get a job, actually. Erica says her first job was babysitting for her aunt. Bobby is coming to us from Compassionate Addiction Treatment. So welcome, Bobby. Rebecca is at Morningside. First job was a cashier at Kohl's. Brian from Kitsap Mental Health. First job working at a call center while also working concessions at a minor league baseball stadium during the same time. So start out with two jobs, Brian. You're an overachiever. Good for you. Jennifer from Goodwill Industries. First job was working in the produce department at a grocery store. We've got Paul with us from Pathways in Washington. And Paul says his first job was a paper route. So single digit aged workers unite, Paul, for sure. We've got Lisa, whose first job was picking berries. Jordan from Rising Strong Catholic Charities worked at a theme park. That actually sounds like a lot of fun for a first job. Yeah. Danielle, employment specialist, or I should say is an employment specialist at DESC. Stephen from EFI, first job was a lifeguard. Hallie is with us today from Compassionate Addiction Treatment. First job was working at a local community center. And we have Willis, Yvonne, and Chase from PCHS. And then McDonald's, and Bucking Hay, respectively, were their first jobs. Rose is here from MRJ and Associates, and she says that her first job was a care provider. Paul, Exceptional Foresters Incorporated, first job Kmart Porter. Elmo's here from MRJN, first job was cutting grass. Jacqueline's here, first job was working at Rainier State School / Western State Hospital. That sounds interesting. Oh, I hope I pronounced this right. Eliel is with us from Yakima Housing Authority. First job was a busser at a small restaurant, and then they say the first real job was working in construction as a helper at age 10. And Pam is from Enric Multicare. First job was picking raspberries. Nina's here from Community Minded Enterprises. First job was working as a waitress / dishwasher / cook at a truck stop. So jack of all trades there, it sounds like. Elle from MDC. First job was a custom protection officer. Patty from Village Community Services. First job was selling cedar kindling. Jason from Grant Integrated Services. First job was at Big 5 Sporting Goods. And Scott from Pierre Kent. First job was working for a neighbor's carpet cleaning business under the table. Oh, you're brave to admit it was under the table. We won't tell anybody. Munzie is with us from Asian Counseling and Referral, and the first job was trimming jeans. That's a new one for me. I don't think I've ever had anybody that I've talked to whose first job was trimming jeans. So that's a first. And then Rhiannon from Ease Employment, first job was at a Subway. So that's great. Thank you all for sharing. I'm happy to be talking with you all here. And Dawn and Darren will tell you, I am happy to kind of play things real flexible here. So if you have a question or a comment at any time, please enter it into the same space you entered your first job and what organization you're with. I think I've tried a few different times to kind of have a very specific sort of time for questions, and I think we miss questions if we do that. So what I'll do, my promise to you today, is while I'm talking, I will periodically just kind of eyeball the questions box here, and if Darren and Dawn, if you notice something in there that I haven't noticed or something, feel free to kind of jump in and just put it out there that we've got a question, and I'll try to respond to it in a timely place in the material today. So what are we here to talk about? Oh, go ahead, Dawn. Okay, good. Thank you. I appreciate you and Darren being my eyes.
There we
a lot of things.
I'm going to share my job. Not first, but one of my. I was a spray plane flagger, which means I was prior to GPS. I stood there with a flag and waved the flag until the spray plane crop duster got a bead on me, and then I would pace off to the next section, and every once in a while I'd feel the wings zinging above my head, and obviously was not OSHA regulated well.
That's funny. How about you, Darren?
Yeah.
What was your first job?
Well, I lived in Southern California and the circus came to town. So I was posting circus flyers in all the local businesses. Where I lived down there, it was great to make money to go to the movies on the weekend.
Sure, that's awesome. Now, did you get into the circus for free if you do that?
I don't remember going to the circus. I think maybe I was kind of tired of the circus, putting up flyers all day long, all week
Yeah,
long.
I bet I
And
could
I get a
understand.
horrible sunburn after that. So
I bet. I bet. That's awesome. Um, thank you for sharing. I appreciate it. So, today we're here to talk about fidelity reviewing, right? And so a couple things, just kind of level set some expectations. So I think most of the folks on this call should be at least an IPS provider agency. And ideally, you're in a position in your organization wherein you are working intimately with IPS services. Either you're a coworker for the IPS team, or you're somebody who's actually serving on the IPS team in your agency. That would make a lot of sense to me, that those would be the people who are interested in attending this, and the people who are interested in potentially becoming a fidelity reviewer in the future. And what's great is you already know more than you think you know about IPS. I just want to put that out there right now. Nobody knows it all, of course. I'll be the first to tell you, and I bet Dawn and Darren and I would all admit in a public forum that's being recorded, we still go to fidelity reviews and scratch our heads sometimes and have to go look at the fidelity review manual and figure out how we need to, regard information, so that we can score it appropriately. It's just the way things are. There's so many moving parts with IPS in general, and then with an evidence-based practice like IPS that has a fidelity scale, it's the manual, it's like 271 pages or so for fidelity reviewing. Nobody remembers it all. So if you're a little sort of afraid of the idea or the responsibility of being a fidelity reviewer, I am the first to tell you you can do it. I'm also the first to tell you, bring your fidelity review manual with you so that you can refer to it when you need to, because you can't know it all. You just can't. But really, again, to take a step back, the fidelity review process with IPS is relatively unique in, I would say, behavioral healthcare or health services, in that it's not just an evidence-based practice, but it's an evidence-based practice with a fidelity scale that's very manualized, and it's widely available for free. So if any agency ever has a question as to how well they're doing with regards to IPS and maintaining fidelity, you can go out and get the fidelity review manual, and you can kind of see how you're doing. Now, it's not as good as objective folks coming in. That's why we have the fidelity review process, but it's at least a way for you to kind of know maybe how you set up a process or a procedure at your organization. And so again, if you get nothing else out of our time together over the next couple of days, I'd like you to just kind of understand and know how important it is for you to know where these resources are. And you'll hear me say it a bunch of times. Ipsworks.org is a good resource for you to have. And I'm going to flip to it right there. I think I'm going to check my audience view. I think you can all see this. Yeah, you can. So what you should be looking at is a website, and it's ipsworks.org. This is the IPS Employment Center, and everything you could ever want to know about IPS is right here at your fingertips. And I don't think there's anything on this site that's that costs you anything unless you go into the shop section. So for example, you can read about what is IPS. You can read about the IPS Employment Center. There's an international learning community that Dawn and Darren can tell you kind of how that relates to Washington, for example. There's training resources. And then what I always encourage people to really go look at is the ipsworks.org document library. Here you can find all kinds of things that will help you get IPS kind of started in your organization. So this doesn't look like the right website. Oh, it's still thinking, sorry. I guess it's a little slow today. So you can see here, it's got all these different titles, things you can do, and when you click on click to view or click to download, it'll just pop right up. So it has, let's see here, what's a good one? A career profile form. If your organization wants to know if there's a better form for you to use for a career profile, you can just go look at this one and you can use it. There's data and record keeping for fidelity. And then I think it's on page 3 is really what I want to show you all. Yeah, the IPS Fidelity Manual. This is what I referenced a few seconds ago. You know, if you're going to be a fidelity reviewer, one of the things you'll need to grab and pull down for your reference is this IPS Fidelity Manual. When you click to view and you open it up, what you get is this thing. And I've already been wrong at least once so far. I said 271 pages or 17 pages, but it's 237 pages. And what this manual is, I'll try to shrink it a little bit so you can kind of see it. It's written by the people who created IPS. And it is exactly what it sounds like. For fidelity reviews, this is the manual you would follow for doing fidelity reviews. Most recently updated in 2019. Every 3 years, they seem to release an update, and it's minimally updated. You know, the idea that the more you update it, the less sort of consistency you have, right? So it's more like tweaked over the years as opposed to, you know, wholesale changes to anything. But what's great about it, if you save it to your computer and then check periodically for, you know, new additions, you should always have the most upgraded version. But then all of these links, you click any of these table of contents items, and it'll take you right there. So if you want to know about consensus scoring, well, that one doesn't click a link now that I said it. But if you want to know about the staffing part of the fidelity review, boom, it'll take you right here. So it's a tremendous resource. As we're talking, if you've already navigated there, great. If you haven't, I encourage you either on break or while I'm talking to navigate to ipsworks.org, go to the document library and pull up the IPS Fidelity Manual as we're going through it. You can look at the screen I'm sharing, and that's fine, but there's nothing better than being able to kind of read ahead a little bit if you want to and that sort of thing. So it's really good. It's really good information for you to have, period. Dawn said earlier, get back here. Dawn said earlier that you know, you all have the ability, and your organization has the ability to become a fidelity reviewer on the fidelity review team, and that's because at every fidelity review there's a lead reviewer, and so if you are on the fidelity review team, let's say with Paul and Dawn is the lead reviewer, your responsibility as that third fidelity reviewer would be to do probably a lot of the same things that Dawn and I would be doing in that fidelity review. You'd be maybe doing some interviews, maybe doing some chart reviews, you know, observation of certain practices for IPS. And we're going to talk really more tomorrow about the specifics of the fidelity review process. But really your role as a member of the team then is to help gather information so that information can be scored according to the fidelity scale. So Dawn and Darren will let you know if you're in sort of an observation only mode on a review, and they'll also let you know if you are in a position where you are in full-on fidelity reviewer mode, because the idea is, you know, again, you may be interviewing somebody and Dawn is interviewing someone else and Paul is off watching job development. So whatever information you gather in that interview, you're going to have to capture in your notes so that the review team can arrive at a score for particular items. So I just want to make sure folks are kind of understanding maybe what the end goal is for this 2-day time together. And I think I see that there's a question that says it stopped working. And that's from Rose. Rose, I don't know if you mean the audio or the video or both, but feel free to pop it in the chat. So let's talk about the fidelity review, sort of the idea behind it. This slide here, it says continuous quality improvement. And if you think about fidelity reviews and why we have them and what's the value in them, it really does equate to continuous quality improvement. And so, you know, the way that it goes is an IPS provider, let's say they didn't have any IPS services yesterday, and so today they started IPS services. What they would kind of build their team and start recruiting, you know, clients into their services. And the idea is they'd use the fidelity scale to set it up the most appropriate way for them. But at some point, a fidelity review team is going to arrange for a fidelity review, which is really just the independent outside eyes coming in, seeing what you do for IPS, and then telling you how closely it aligns with the fidelity scale. It's not punitive. It's not intended to be a gotcha. It's intended to help you get better at providing IPS. So, the graphic on the right side here, define, measure, analyze, improve, control. This is exactly what IPS fidelity reviews are all about. We're not about docking points because we don't like somebody's attitude or anything like that. We are all about the sort of the purity of the model, with the idea that fidelity is fidelity. I've done a lot of reviews. I think I've only been to one organization that got anywhere near perfect score. They missed 1 point. They've been doing it a dozen years, or I mean, they were experts at it for sure. Everybody else kind of spends time in the fidelity range. So as a provider, it's easy for me to say don't sweat fidelity, but I think all we're really looking for is incremental progress when we do a fidelity review, but also there's an understanding that anything that changes might have an impact on your score. So the easiest one I can come up with is, we're all healthcare providers. Turnover is something that we have to deal with every day. And if you are a provider, an IPS provider, and you have 2 employment specialists who, I don't know, let's say they get their master's degree and they move into therapy roles at an organization, that's not bad for your organization, but for your IPS program, it's going to be a devastating thing to try to get up and over if you're still recruiting and still trying to hire a new employment specialist. So all of that context is worth just kind of keeping in the back of your brain as we talk through some of this. And again, feel free to ask questions. You are welcome to ask questions about, I think the way it usually goes, I should say, is people usually ask questions about the fidelity review process. But in day 1 in particular, I mean, we're going to talk about fidelity scale items. So it's okay to ask questions about, we have a lot of times that people ask questions such as, at my organization, we have it set up this way. How would you score it? Or is it okay? Those are good, natural, curious questions. I want you to think about things both kind of from your organization's perspective, and then really, as a fidelity reviewer, for me, what really opened up my eyes as a fidelity reviewer is going out to these other organizations and seeing how they have rolled out the same exact evidence-based practice I have at my organization, but they've done it differently. Not better or best, and the scores are the scores, but kind of like, wow, I never even considered that way of doing things. So you'll learn a lot too as a fidelity reviewer, and I really encourage you to go at this with open eyes and open ears and open arms, because it's a really neat idea. I mentioned about the Ipsworks website, and they've got an international learning collaborative. To me, one of the best things about IPS is the idea of learning collaboration. So there aren't many other things that organizations do, human services organizations do, where there seems to be such a lack of sort of competition. I've seen IPS providers in the same city who really, their therapy staff and maybe their upper administration want to have a bigger market share, more clients for them versus the other. But the IPS teams are not really wired that way. They seem to be more of a, I'm here for the purposes of helping people get jobs, and if that means that I need to try to link them with another organization that has some sort of unique skill or whatever, I'm going to do that because it'll help the client. And I think it's really refreshing to have that interagency collaboration. Also, a hallmark of IPS is the collaboration of the IPS team within its own agency. So agencies that are doing IPS very, very well, they typically have IPS teams that are really kind of integrated into the service lines of the organization. They're kind of all over the place, and you'll see as we go through the fidelity items that organizations are kind of measured on how well they are able to integrate into the other teams, the non-employment teams, if you want to think about it that way, into their own organization. And that's because IPS is most successful when it really becomes a culture of work for the folks that are served by the organization. So that's very cool. And then beyond that, I think every state I've ever been to and ever heard of has sort of a state learning collaborative, and that's why Dawn and Darren are a part of the call today. They have been instrumental in Washington in kind of assembling all of the IPS providers together and offering things like what we're doing today, so that providers can learn, providers can kind of grow their skill set and really reflect back on how they provide this service and kind of make it better for the client. not, and again, it's not competitive. It's not about being the best in the state of Washington. I'm sure some of us are wired that way, right? But you know, if we really want to do good work, then that means we really want to help people get employed. And so agencies that are very successful tend to kind of embrace that sort of idea of collaborative work, not just in their own organization, but with all of their sort of service partners locally and then statewide as well. Very, 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 very neat. The IPS Works Learning Collaborative, it's an international, so I'd have to look at the website to figure out how many countries have kind of enrolled in it at this point, but I believe, and Dawn and Darren, tell me if I'm wrong, but I believe Washington is a part of the International Learning Collaborative as well, you know, which opens you up to specific training and other sort of resources as well.
Yep, that's absolutely the truth. And I want to say there's 7 countries at this point in time, maybe 6, something like that.
You know, there's new ones all the time, so I do tend to lose track, and I have to go check myself just to make sure I say it right. So I think I default to not saying a number. But yeah, IPS is all over the world. And what's interesting is that, you know, there's really no difference in Fidelity Scale for, you know, I don't know, I'll make up maybe Denmark, for example. Denmark IPS providers follow essentially the same IPS Fidelity Scale that all of you do in Washington. The language is different, certainly, but beyond that, I mean, the core functions of IPS are exactly the same across the world, which, you know, rises to a level of evidence-based practice that I think very few other practices have made it to. Even something as simple as cognitive behavioral therapy, you know, which is an evidence-based practice, it has its limitations. And I'm not here to knock on CBT. I'm a trained counselor. I shouldn't knock on CBT, right? But nonetheless, it's different in many, many ways. And the way people use CBT has variability in different cultures. And so IPS is, I'm an advocate for IPS for many, many reasons, principally because whenever you meet somebody new, one of the first 3 questions you ask them is, what do you do for a living? It's that important in our society, what you do for a living and what work is to you and how you define yourself by work. So it's the kind of thing that is it's a major life domain, and it is a productive measure of sorts. And if we're trying to help people get better, whatever the, you know, primary diagnoses is for the folks that you serve, if we're trying to help people get better as care providers, we're really leaving an important thing out if we don't talk about work and help people get work, right? It's important to us all. One of the things you'll notice as we start looking through the Fidelity Scale is that there's this sort of item here, the IPS diversity of provider type, and it talks about how frequent contact between practitioners helps them work as a team to assist folks with their employment goals. And really, the scale talks about that good integration I was talking about earlier. It also, that integration helps to make sure that people don't receive conflicting messages. And the best example I'll give you, so I told you all I work at a mental health center. If I'm the employment specialist and I'm talking to somebody about how, you know, I know of a job that I think they'd be a really good candidate for, if I'm telling them that in one conversation, and then in a conversation, let's say with their, well, I said therapists earlier, so with their therapist, if their therapist is telling them, I don't think you're ready for work yet, you know, that's a mixed message. It's a message that, you know, is in direct contrast to one another. The messages are in contrast to one another. And you can see where a client might really be unsure how to proceed with getting these mixed messages. So with good integration, we can hopefully ensure that clients receive the same message. And certainly you'll hear me talk about readiness as we spend these next couple of days together, and moving away from that sort of readiness idea. The idea with IPS is that people are ready to work when they tell us they want to go find work. It doesn't matter if they're drinking, it doesn't matter if they're doing drugs, it doesn't matter if they're taking their medication or not, or if they're showing up for appointments. None of that stuff matters with regards to finding employment. And it's true, it doesn't matter. The research supports it. It's very definitive. The note here that I want to make sure I say to folks, especially after hearing kind of the provider organizations that folks are working with on this call. In the Fidelity Scale, you'll see a lot of talk about working with people with mental illnesses. And that's because IPS started there. It started as an evidence-based practice for people with mental illness. Over time, and as the research has supported it, we have identified that IPS is very effective with many, many other populations, certainly disability populations, but even populations that have nothing to do with disability. And the best example I'll give you there is the federal government has several studies that show how effective the IPS supported employment model can be with veterans, not veterans with a disability, but people who have served in the armed forces, period. So IPS is applicable and suitable for many other populations. So if you're sitting in an organization right now that is not a mental health practitioner, mental health provider, whenever there's a reference in the Fidelity Scale to the mental health treatment team, we're just going to change that to whatever the appropriate service team is for your population. So let's say you work at a substance use disorder service organization. So you provide addiction treatment services. If you're on the employment team at that organization, and we see something in the scale that says mental health treatment team, the Dawns, the Darrens, the Pauls, the future yous on this call, we're not going to go look for a mental health team at that organization. We're actually going to look for you to integrate with and connect with the appropriate substance use clinical team, whatever they call it at that agency. Some people call it a treatment team, some people call it, whatever team. But that's really what we'd be looking at as it's relevant to that organization. So we're just going to sub out mental health when relevant and appropriate to whatever the team is for that particular population. Another example I'll give you, I did a Fidelity review for a team in Chicago, and while it's a mental health center that kind of that employs this team, the team provides services to individuals if they are deaf or hard of hearing, period. They don't have to have a mental health diagnosis. They don't have to have any disability or any, they don't have to have anything sort of that qualifies them for mental health center services. All somebody would really need to do is just kind of identify that they have some sort of hearing deficit, and this team will help them find employment. So when we reviewed that team, we looked for the relevant sort of quote unquote treatment team for them. And so there was some, specific sort of hearing treatment professionals at the table for they called it a clinical team meeting. There was also a member from, in Illinois, it's called the Department of Vocational Rehabilitation. So, you kind of interpret some of these terms for each agency, if that makes any sense to you. And so I just want to take a minute here and just kind of let that kind of bounce for you. And then Dawn and Darren, certainly if you have anything Washington specific or otherwise that you wanted to chime in on this particular, the providers way better than I do, of course, in Washington. So I'm happy to have you chime in here.
Sure. Well, and one thing I just wanted to talk about when you're mentioning treatment teams and the fact that IPS was originally written for working with people with mental illness, when we're looking at those treatment teams in other agencies or support teams or service teams or whatever we might end up calling them, what we encourage agencies to do is to consider who sends you your referrals. Mm-hmm. Do you have a couple of teams that send you the most referrals? Maybe it's your housing team, maybe it's maybe it is DVR, maybe it's whomever. And so we kind of put it in context by encouraging agencies to consider who sends them their referrals, and then that's who you better be collaborating with. It's kind of the bottom line.
Yep, for sure. That's a good point, Dawn. And one of the first things I do in an organization in the kind of day one in the morning is I really try to spend time having an organization kind of walk me through how they define some of these things. And it can be really helpful. And another part of the Fidelity Scale where I have people try to interpret it for me is you'll see that we will score executive team support for IPS, and every agency is set up differently first. And second of all, the titles are really I don't want to say they're cheap or whatever, but some organizations have a CEO, some have a president, some have an executive director, some have a clinical director and a support director. So you really need to spend time understanding from the team and the organization on that day one, who do they consider their executive team? Is it, the chief financial officer, or is there sort of like I've been to an organization where the QA director is the person who is on all of the legal documentation for the organization, but they don't call them president or CEO or any of that stuff. They're the QA director. And so it's not for me to judge whether I like it or don't like it. It doesn't matter what Paul thinks. What matters is, what matters in that particular example is, so if your QA director is your president, essentially, are they involved in IPS in any meaningful way, or are they completely separate from it? So the first thing I think that is worth doing at an organization is just understanding how they interpret some of the key terms of the Fidelity Scale. So as a reviewer how to more appropriately, more fairly provide a score to them upon your exit from the Fidelity review. So let me stop right here for a second and see if there's questions. We've been going about a little over 40 minutes, so I know it's been a little light duty, but I just want to make sure if people have questions right out of the gates that we take a minute to answer them. And Dawn and Darren, as well, you're both always welcome to chime in at any of these points too.
And I was just going to kind of chime in with a public service announcement, if you will, while folks are thinking about their questions. We are still looking for agencies that want to be part of a Fidelity review team on the supportive housing side. And I know that there's a lot of agencies that do both supported employment and supportive housing. So supported employment, Darren and I have been incredibly fortunate in that we've had a lot of agencies be interested in either hosting a review, being on a review team, something like that. Fewer on the supportive housing side. So if your agency also does supportive housing, that may be something. If you're not going to do supported employment, consider whether you might do supportive housing in relationship to a Fidelity review. So, and I'm assuming that, in fact, I know a lot of the folks that are on the call are because they've got a review upcoming or going to be a reviewer upcoming, and so that's the reason why they're here.
Sure. And we want to set them up with all the info they feel like they need too.
I'm going to just add to that public service announcement, Dawn, because there's a great training coming up for the Golden Thread series, which is going to focus on medical necessity and documentation. It's a 6-part series. I think that comes up in the next month. And if people are interested in it, you can put your email in your chat box so we can make sure you're on our Gov delivery system to get that information, and a wealth of other trainings that come out monthly from the HCA. And the last piece I'm going to talk about is the HCA is incentivizing some new contracts. Currently, we're looking for providers who are interested in implementing supportive housing, supported employment, and a substance use disorder SUD facility. So if your agency is currently performing those functions and interested, please reach out to Dawn or myself so we can talk to you more about those incentive dollars. Thanks.
All right, those are good PSAs. I feel like I should have one. I don't know. Get your vaccine and stay safe. That's a good PSA, right? I don't know.
Paul, you have so much good information that you don't have to have any PSAs. How about that?
Oh, you're too kind. You're too kind. So I think we might have a question. I just saw the little thing pop up. Okay,
looks like
so
Patricia put in her email address to be put on the distribution list. So we'll make sure that happens.
Yep, and anyone else too, if you want to get put on a distribution list, by all means, please share your email address so we can get stuff to you. What I pulled up, I figure what we'll do here, since we're kind of coming up on the hour, is I'll just kind of walk through a little bit of this Fidelity, orient you to the Fidelity items, and then leave you with a question. We'll break for about 5 to 10 minutes, and then when we come back, we'll just kind of start getting some of the answers to the question, and we'll start chugging through these Fidelity items. I'm trying to figure out the best way to break all of this up in a way that kind of works for everybody, and sometimes it's difficult. So this is the Fidelity sort of scoring sheet, and it's a really nice way to look at all of the items that you will score an organization on as a Fidelity reviewer. And the first thing I always like to point out is, just keep in mind, it's broken up into three sort of pieces of Fidelity. The first is staffing, which is comprised of caseload size, and that is the average. We'll talk about it, but it's the average caseload size between all of the employment specialists. So, if you go in and you're doing an interview with an employment specialist, and they tell you that they have 35 people on their caseload, you may think like, oh gosh, the Fidelity Scale says a maximum of 20, but it's an average of all the employment specialists. So if another employment specialist has only 6 on their caseload, you average 6 and 35, you may be closer to 20 than you originally thought in that one interview. So again, that's all the more reason for Dawn and Darren and I to make sure we take good notes in interviews, because when I come back to the table, if the only thing I have to say is, well, I didn't get the number from them or the caseload size, and Darren and Dawn are going to have a hard time scoring this item, because I don't have the notes. So you'll hear me say that over the next couple days, about how important it is to kind of keep good notes, and they have to make sense to you. That's the important thing with Fidelity review notes. I don't think I've ever been on an interview where, like Dawn says, Paul, give me your notes and I'll do the scoring, because you'll hear we have a thing called consensus scoring, where we all go through the scores together. And according to my notes, I share what I think I can most reliably score an item. So again, the notes really just have to make sense to me, because Dawn's not going to need to read them. And if any of you saw my handwriting, you'd know that Dawn couldn't read my handwriting anyway. So, because it's terrible. The second item of staffing is employment services staff. The third item is vocational generalists. And we'll go into a more thorough review of these in a few minutes here after the break. But in the organization section, you're really looking at how the employment services are integrated in the organization, how they've kind of made space in IPS, or space in the organization for IPS. And you can see here right out of the gates, the first 2 items are measuring the integration of the IPS team into the teams of the agency. And so here's an example of that sort of caveat I talked to you about on the last slide. It says mental health team, but if you don't work in a mental health organization, or you're at an organization that doesn't have a mental health treatment team, this is where we would just kind of want to tweak the language when we're looking at these scores for the most appropriate clinical team. And Dawn's right. That's a great question to kind of ask the agency, where do your referrals come from? Because that's really that's the team they support, if you want to think about it that way. We also look at the collaboration between employment specialists and the voc rehab counselors, how they've constructed the vocational unit, how the employment supervisor kind of provides the most appropriate supervision for the team. And when you cruise around Ipsworks website, one of the things you'll see in a couple of different documents is that IPS is only as good as its supervision. And that is true. So you'll really want to understand from the IPS supervisor how they execute their role so that you can score this item. There's some real specific elements of this item that are worth just making note of. 0 exclusion criteria, the agency focus on competitive employment, and the executive team support for supported employment go into organization. And then services, this is really sort of the what they do part of IPS, and it looks at all of these things listed here. I won't read all of them to you just for the sake of time and because we're going to go through them. But one of the things I'll tell you all is on almost every Fidelity review that I've been on, the staffing portion and the services portion, the IPS team seems to have that down. They know it pretty well. They do a pretty good job at it. And it's the organization part that really starts to get difficult for them, because it requires another entity. Almost every one of those items requires another entity for them to score very well on those items. So, they need executive support in order to integrate fully with the other teams in the organization. They need good supervision in order to, have 0 exclusion. So those interplay between items are really important for you to flag as you're kind of going through a Fidelity review. And you'll learn, just like I did, and just like Dawn did, and just like Darren did, you'll learn sort of what to listen for. And then again, when you don't know, that's okay, because we've got the Fidelity Review Manual. And if the Fidelity Review Manual doesn't answer the question or concern you have as a review team directly, you've also got consensus scoring to kind of lean back on or fall back on, where if Dawn and Darren and I don't have the automatic knowledge of how to regard something in terms of scoring, the first thing the three of us are going to do is consult the manual. And if the manual doesn't overtly say score it this way, Dawn and Darren and I are going to have some discussions. We may ask the IPS team to provide us with more information. I always call it phoning a friend. So you'll develop fidelity review sort of colleagues. You may shoot them an email or give them a call and say, hey, I'm at this organization and they've got this, that, and the other, and I'm thinking it's a 3, but I don't know, I'm really not sure. And you just kind of get a little external feedback from it, from somebody, from a colleague, just to kind of, if nothing else, kind of validate what the team's thinking. And it ends up working out. And if you score it one way, let's say you scored a 4 and the team says, yeah, but there's all these other things that we didn't show you that would impact the score. As a fidelity reviewer, the easy answer is, well, I was there for 2 days. Like, why didn't you show it to me? And it doesn't have to be contentious or anything like that. And I know there's some ability, Dawn has mentioned, after the fact for an organization to kind of provide supplemental information. So there's even sort of a fail-safe there, all of which I say to really just kind of underscore, we're not there to do gotchas. We're not there to catch anybody doing something. We don't expect perfection. We're there as fidelity reviewers to give them the most accurate score, period. It doesn't matter to me as a reviewer if they're at 125 on the scale or if they're at 80 on the scale. I want to have them scored what is most appropriate and accurate for the services they provide. And then I want to be able to provide recommendations or feedback to them on what they do really, really well, because every organization does things really, really well. And I also want to provide feedback to them on the things that they could use some work on, not necessarily how they could make the score better or the right path to that, but here's what the Fidelity Manual says would be a 5, and right now you're scoring a 3, so here are some things to consider. So again, this is very collaborative, two-way communication approach to getting the most accurate score. And beyond that, again, there's no editorializing or anything like that. Organizations are provided with a full report that describes the fidelity review activities. So we're all very transparent with this. We're not trying to pull any punches. So it's about 7 minutes till. So what I was thinking is around 5 till we could break and then kind of come back 5 after the hour. So the question I was going to leave everybody with is either as a provider agency or as a potential fidelity reviewer, what are the things about fidelity reviewing that either you're most afraid of or worry you, or the things that you feel like, gosh, I don't know if I'll be able to get that in order to be an effective fidelity reviewer. So really just kind of wondering, what are those things out there that spook you about the fidelity review process, either as a provider or as a potential fidelity reviewer? Because I think there's probably some similarities between the two. And if that makes sense, then what I'll do is I'm just going to kind of mute my mic and I'm going to take a little break, and then I will see you all right around 5 after the hour. And you're welcome to type answers to that question into the question chat, but I'll also ask it again when we come back from break. So I will see you in a few minutes here.
How's everybody doing today? Hopefully having a good day. I am actually in my home office in Moses Lake, which is where I'm coming from, and it's sunny and supposed to go up to 58 degrees today. So I feel pretty fortunate. I've seen some good responses in the chat box from Paul's question. So do by all means continue with that as well.
And I'm back, Dawn. I'm looking at some of these. These are some great questions folks have.
Yeah, absolutely.
I'll just wait for a couple more minutes just to wait for a few more to come in, but this would be good to start with.
And I can't stress enough, no one feel like you're alone when you're doing a fidelity review, because you'll be on a review team. And one of the things that I think both Darren and I do is we spend time with the review team members prior to the review, doing a little more coaching about here's what to expect and, you know, kind of here's what you're going to do. And then during the review, you know, we kind of guide, you know, we're all going to be in this particular interview and listening to the unit meeting as an example or whatever, and kind of let folks know what's going to happen in each particular circumstance. So nobody's turned loose. Everybody's part of a team, and we all collaborate and talk. And you know, I'll mention you had already mentioned, Paul, but I'll mention the notes again. I cannot stress how important it is to take good notes during the review, because maybe not in every consensus scoring meeting that we do, but pretty often somebody will hear something that I didn't or one of the other team members didn't that changes the score one way or the other. So, and I will promise that you cannot remember everything that people have said, so you've got to take good notes. I can't stress that strongly enough.
Agreed. And a lot of it too, I'll just kind of add to that, Dawn, is so the way we do things in Illinois is not the same way that every state does things. So in Illinois, we do a fidelity review. It's a 2-day review. By the end of that, we have given the organization sort of a tentative score based on what we saw, and then usually the lead reviewer will create the fidelity report, send it out to the other 2 fidelity reviewers for their observations. And so here's the thing: even if I get that report 2 weeks after the fidelity review, without my notes, it would be probably impossible for me to recall with any specificity why I scored something a 4 or what the recommendation was is probably more important. What the recommendation is for the organization, because at the end of the day, we want all this to be valuable information that we provide to the organization that helps them get better, and it's actionable data. So if your notes, or you don't take notes, or if your notes aren't very they aren't a good enough quality, you're going to have a really difficult time as a reviewer providing feedback to the organization.
Absolutely. And I know we talk about score, and the score is certainly important. It places you, you know, whether you're not supported employment or fair fidelity or good or exemplary or whatever. But truth be told, my personal opinion, the recommendations are more important than anything. That and the kudos that we give agencies, that narrative that explains why they got the score, is so much more important than the score in my mind. And I think back to being a kid and getting a report card, if you will. The A's or B's or whatever were, you know, great, but when I got a comment from the teacher, or, you know, for that matter, my own personal evaluations when I've been working, you know, whatever the score is, but when I got a comment, that's when it became clearer in my head and more meaningful to me as far as what they were talking about. And it's the same thing with the fidelity report.
Yep, absolutely. Yep, it is. I always like to imagine that the fidelity review process really just holds a mirror up for the organization so they can kind of see with outside eyes how they are performing. Beyond that, there's really, like I said earlier, there's no editorializing or anything like that. So really, my job as a reviewer is not my job is to follow the process that's been laid out by ipsworks.org and the IPS Employment Center, so that mirror is, you know, not a funhouse mirror, but a very accurate mirror for them. That's the best thing we can do. So it's 10:08, probably your time. I'm just going to start going through some of these confessions from folks here. So the first one is, I'm new in this all. I'm a little nervous, but so excited to do this because I will also be learning so much, and I think it will add so much to our program. So not only am I reviewing, but also learning and picking up new skills. Absolutely. Bobby wrote that in, and I'll tell you, Bobby, again, as a provider, I think your your program will by default get better because of your work as a fidelity reviewer. Like, you understand things sort of from a different perspective. So that's a good comment, and I totally agree with it. Alana says, being new to the field and the process, I think following a sheet like the one presented will definitely help jog questions. If left to ask questions on my own, I feel I would forget key points. After attending these several times, I am feeling more confident in my ability to ask the right questions. That's great. And I'll put another plug in for the Fidelity Review Manual that has got sample questions on it, and there's no shame in following those sample questions in an interview, especially if you're in your first interview kind of solo. I did that when I was a brand new Fidelity reviewer. I kind of had a crisis where I felt like I didn't know anything that I thought I knew, well, about 1 minute before I was supposed to go interview somebody. And I just got out the Fidelity Review Manual and started asking the questions. And you know more than you give yourself credit for, is what I'd tell you. So yeah, you're going to be in good hands with Dawn and Darren, that's for sure.
Hey, Paul, I just want to jump in because I just completed a review last week and I already went back to the manual to check it in. So part of my tools that I share with everybody is the Fidelity Scale and the manual. And I don't want people to expect that they have to go through those multiple pages to really, absorb as much as you can before the review. It's good to kind of learn where some of the information is at, because as a group, when we look at things, we'll be going through some of that together. But it's good to be familiar, but I don't want people to think that they have to like study the manual before we actually do the review process. And I've been doing this a year now, and I still go back and review to look at some of the information in the different sections to get clarification. It's about clarity and learning together.
Yep, absolutely. And I'm the same way. I have mine. Mine's a beat up old version, and I've got notes scrawled in the margins and post-it notes, and whatever you can do to have your manual make sense to you. And you'll see as we start going through some of these items today, there are some items that they make perfect sense, but there's one sentence in the manual that says, "Oh yeah, but when you see this, only score a 4." And those are really the things you want to know. If you have to remember one thing about a particular item you're scoring, you want to remember, or at least have something to jog your memory in the manual that says, yeah, but don't forget about this particular scenario. And so, yeah, it's good point for sure.
Well, and I'm going to say that I expect everybody to actually memorize the manual. Kidding.
I was going to say, Dawn, we lost the connection with you all of a sudden, it seems like. Everybody simultaneously kicked you off the call.
That's my expectation. Sorry.
Yeah, that would be quite a feat for sure. I don't think I know anybody that memorized it. The only person, to be honest, I know it was a joke, but there is a guy in Illinois who helped write the manual that I've worked with, and his ability to recall portions of the manual without it in front of him, it's absolutely spectacular to be a part of. But beyond the guy that helped write it, I've never known anybody that didn't have a copy with them, or at least available to them. They have a laptop or something and have it and pull it up online. So yeah, there's certainly no pressure for memorization at all. We have enough to remember.
I'm sorry, I couldn't resist.
No, I don't blame you. That was a good one. So Jean writes in here, regarding the 2 job development role plays, how valid is it when we do not meet real employers in the community? So I'm not sure if this is related to a comment that was happening on break, or if this is about job development shadowing.
This is in relationship to what we've done differently doing virtual fidelity reviews.
Oh, sure.
And I have to say, it's not sanctioned by the WSTAT folks. It was as we were trying to figure out what we were doing early on, this is what we came up with. We make very clear that this is not the ideal. That because we're doing things virtually, we wanted to continue to give agents feedback. And this was early on when we were hearing from the West App folks, don't do anything, let's just wait and see. Well, COVID's going on for an awfully long time. And we wanted to continue to get that incentive money out to agencies, knowing that with COVID and that the way they had to change their business practices, that some agencies were just failing financially altogether. So a part of this is based on us wanting to make sure to have that financial incentive available. And so when we did came up with the job development role plays, we did so as the only way we could think of in order to actually come up with some kind of meaningful feedback related to that. What I will say is it's turned in the long run better than I thought it would. Still not as good as going out to observe job developers going out in the community. So that's kind of my response to that.
Yep, I agree with everything you said, Dawn. And I guess what I'd say too is, with role plays, you're at least able to score something that you observed. Without role plays, you wouldn't be able to score those items. So I think it's better. And like you said, is it perfect? Probably not. But the other side of it too, just kind of related to this comment, is part of the Fidelity review process is we go in and we tell agencies, bring us 10 charts to review. And it always amazes me that you'll review a chart and it doesn't have something in it you're looking for, when we've asked the organizations to kind of pick their own charts. So I guess my counter question could be, how valid is it for us to ask agencies to do their own chart pulling in a Fidelity review, whereas maybe with a go ahead.
No, I agree with you. I'm sorry. It was just a spontaneous, yep.
Yeah, so, I think a lot of this, just to kind of sum up this particular question, a lot of the Fidelity review process is good faith exchange of information. And I know that at probably 8 or 9 out of 10 agencies, they look through the charts before the Fidelity review and they probably pick the best ones they can find. And that's fine. I'd rather see the work that's reflective of how great they can do, rather than a chart that's, a minefield. I don't want to give them a score based on, the outlier. I want to give them a score based on what's really happening in their charts. So in the same way, you kind of get, it's not perfect, but you get a good idea through a role play, where people need help. And I'll tell you too, even with real employers in the community, again, employment specialists, they don't pick employers in the community that they have terrible relationships with. They pick, I would love to have somebody they've got a longstanding relationship with, and they've got somebody placed or recently placed at an employer. I'd love to have somebody who's like had an applicant, and they're kind of in that stage. And I'd love to see job development where they kind of do a cold call and they see a now hiring sign or whatever and go talk to a hiring manager for the first time. The reality is time doesn't always allow for those 3 events to occur. And so often what I'm left with as a Fidelity reviewer is I watch somebody do job development with an employer that they obviously have a tremendous relationship with. And so that's all I can score. And at some point, again, if you go back to, we're not there to do gotchas, and we're not doing any sort of audit or anything like that. I'm happy with the agency telling me we do great work. Look, see, we do great work. And I'll say, yeah, it looks like you guys do great work. I don't have a problem with that at all, because they do. I just watched it. I watched it happen. So one of the things in general that I like about the IPS sort of process with all of this is you'll see, basically you try to give them the score that's the highest full score that is met. So rather than flagging them on the one error you find, a lot of what we're going to score is percentages, which really mitigates the whole sort of one-off problem that agencies may have. So we're going to give them credit when we can, and we're going to try to give them a score that's as fair as possible. So a good question, very good question. The next one is a fear that I'm not able to get enough information through telecommunication. And I think what man means here is like through the virtual format. And I think that's something we're all sort of struggling with, like Dawn mentioned. It's not ideal. I mean, it's just not, none of it's ideal. This training, spoiler alert, this 2-day training where I'm talking to you over a webinar and I can't see your reactions on your faces and you can't see me and et cetera, this is not ideal. The last 12 months have kind of been not ideal. So we're just trying to put it together. That's a rational fear that we're not able to get enough information. But remember, as a reviewer, by default, when you feel like you don't have enough information to score an item, I want you all to remember, ask for more information, period. Just say to the organization, do you have other information we could use to score on such and such, whatever the item is? They'll bring it to you. And if they don't have it, they'll tell you, I don't have it. And then you can only score what you saw. It's not a perfect science. You know, we're not doing organic chemistry here. This is people business. And so it's going to have inherent flaws. But it is, of all the sort of practices that your average health services agency does, this one is the most manualized and sort of standardized work with regards to review that I have found. I mean, what better as a fidelity reviewer could you have in your arsenal than a full fidelity manual that's based on research, that tells you exactly how to score all the information you receive, and then at least 2 other fidelity reviewers that when you don't know what to do, you could kind of bounce an idea off of them with regards to scoring, and the 3 of you come up with a consensus score. I mean, there's a big safety net as a fidelity reviewer. So, and again, you know, if you get it wrong and it's a 3 and the agency says, yeah, but you know, we think it's a 5 and here's why, maybe they didn't show that information to you, and you just say, okay, well, now that we know that, it's different, right? But be flexible, be open-minded. Nothing's set in stone. Darren says, my biggest fear is finding out that I have been doing something wrong all this time. I think probably all fidelity reviewers worry about that. But again, if you stick to the knitting of the Fidelity Review Manual, you know, you should not have, this should just be a fear. It shouldn't be something that realizes itself. At the end of the day, if the organizations don't give you the information, all of the information they have available to them, that really ends up being on them, not on you. And you kind of got to leave it there, unfortunately.
You know, Paul,
From the standpoint, oh, go ahead.
I was just going to say that's a really good point, because we're all trying to get as much information and find out what the agency is really doing well. And that can really affect us as a team if we're not able to get all the information. And one thing that we try to do is have a debrief appointment for the review team at the end of the day, so we can collectively ask more questions from the agency we're reviewing to see if we missed something, or an opportunity to collect some more information to kind of answer some of those questions as they come up during the review, because questions will come up. It's a virtual process. Things can get a little wonky. We all need, you know, a little extra bandwidth of patience, and plus doing things virtually, it's a little bit more exhausting, I think, than doing it face-to-face.
Yeah, and you know, that's a good point. Go ahead, Dawn, because I got something I'll add to after you guys both kind of get your points in.
Oh, I was just going to say to Darren, if you're kind of referring to the fact that you find out that you're doing something wrong within your own agency based on the fact you're a fidelity reviewer, it's a learning collaborative. That's part of what it's about, is to be able to certainly review the agency that's being reviewed, but also to take back with you lessons learned about things that you might use to improve your own services. So it's not so much the doing something wrong, it's the how can we do better, that continuous quality improvement.
Sure, agreed.
That was.
Yep, and I think I forgot the point I was going to add in there, to be honest with you.
I'm sorry.
But no, that's okay. That's okay. It must not have been too important. That's what I always say. I can almost guarantee all of you, as a fidelity reviewer, you will learn things on a fidelity review that you can take back to your organization and implement to make it better, to improve your scores. I almost guarantee it. Somebody's going to be using some slick document that you never thought of, and you're going to use it, and you're going to solve some big problem for your team. It's really cool, and it is collaborative in that way, like Dawn said. The next one here says to deliver a good report and giving feedback. You know, this is a good statement, Nina. You've got a team. It's not all on you. So that's the first thing I'd say. And this is kind of related to the next comment too, Paul says, for my first review, fear of the unknown, questioning my own performance. Am I doing well? What do I need to improve? Being vulnerable. Remember, it's not all on you. You got a team. So you got a Fidelity review team. So, you don't have to be perfect. You just got to be human. And learn. And I don't think, and Dawn and Darren, correct me if I'm wrong, but I don't think the plan is to take you from this webinar and throw you right into a Fidelity review as a reviewer. I think there's additional observation opportunities for folks, because at some level too, we want to make sure that the next reviewer, has some capacity to provide the feedback we need them to provide. So, there's a safety net. You've got all kinds of resources at your disposal, and it's not at all like the spotlight's on you. Here's it's not, you don't have to tap dance in the spotlight for the other reviewers. So we're there to do it together. So, and I always tell new reviewers too, whether it's, on a break or, hallway conversation or something, I always encourage them, hey, if there's a spot in the Fidelity review that you feel like you haven't seen enough to score accurately, let me know and we'll do it together. So if there's somebody who, I've never interviewed a group of clients before, fine, like let's do that together then. We won't make you go solo on it. Or I've never done a chart review before, just raise your hand and say that, and the review team will kind of accommodate that so that you are comfortable. And nobody wants anyone else to be uncomfortable throughout all of this.
Yeah, and I will say that one of the things that happens, partially because I'm a chatty Cathy and partially because I take my lead reviewer responsibility or role responsibility very seriously, is that usually if when I have a team of reviewers, I may start out with the introduction. I may ask the first few questions and then say, team, what questions do you have? If somebody doesn't feel comfortable asking a question, I don't ever push them into doing it. When they are comfortable, then they can ask questions. And typically they end up being from that list, at least to start out with. Yeah. There are folks in this training that are going to go on a review in the not too distant future. Once again, with us as leads and kind of guiding things and sharing and mentoring. So my responsibility as a reviewer is to review the agency, but it's also to provide mentoring to the reviewer team so that they learn more about Fidelity as well. When we do our chart reviews, what we do is a Zoom meeting, and we have all of us in the same spot. We have the agency show us or tell us where to find things in the chart, and then they leave. And the review team members are still there, and we talk with each other. Have you found this? Where did you find this? What did it look like? Does this qualify to address this? Does this? So we actually have that conversation during the period of time that we're doing the chart reviews together. And by the end of the first one, I think, first chart review that you do, and usually folks either do 2 or 3 of them, depending upon the size of the team. By the end of the first one, then they have a little more comfort level, a little more idea of where things are to be found. But I volunteer at any given time if somebody needs help with writing the report, if somebody needs help with doing a chart review, if somebody needs help with whatever, that's part of what I'm there for.
Yep. And so, Dawn, in Washington, does the lead reviewer kind of take the responsibility of putting the final report together?
Yeah, we synthesize the pieces that everybody sent in. In some cases, clean them up a little bit if they've missed the intent. And then we send the draft back out for the review team to take a look at. Because once again, that's a learning experience. Gee, this is what I wrote. This is how it got, tweaked. So I see what the difference is, kind of a thing.
Sure.
And then also.
Dawn, are you still there?
Well, I'm not sure where Don went, but definitely, we look at all the information that people provide during the report development, and it's a very shared collaborative process.
Very much so.
Yeah, and really, I mean, I think I can speak for probably all lead reviewers across the world at this point. I mean, the last thing we want to do to another Fidelity reviewer is put them in a spot where they feel unprepared, to deliver sort of the score. So the team is collaborative as well as the process. So we'll make sure that everybody feels comfortable doing what they're doing. That is a for sure. another comment kind of on the same theme is I'm worried that I will not know what I'm looking for. I'll know more after this training, of course, but I guess being efficient is my worry. So again, sort of along the same lines there from Nina. And then Harrison says, as a provider for services and being new to the program, so I'm just worried that I may not always be doing everything right or leading people to the right place. Slowly learning and getting things down, but just that overall anxiety of doing the job right and making sure I'm actually helping my clients. Always nerve-wracking to make sure that I'm doing my best and lining up with Fidelity. Also with employer contacts, it feels I'm not doing my best with COVID in play. I think we all kind of feel that way, first of all, Harrison. And then somebody else chimed in, Christy chimed in, that's my fear too. Been doing this so long, what if I've been doing it wrong all along? So the counselor in me, and Paul, would say to you all, this is great. All of this anxiety that you're all kind of ventilating with us here, that this is great because to me, anxiety shows that you care about something and you want it to go well. So that's all coming from the right place. And so now I'm totally convinced that nobody's going to have fundamental problems with the Fidelity review process, because if you care this much to kind of bare your soul to us with regards to IPS in the questions box, I know you'll have your Fidelity review with you and you'll be ready for the Fidelity review. And when something pops up that's outside of your comfort zone, I know that you will raise your hand and you'll say to Darren, or you'll say to Dawn, or you'll say to Paul, I've not seen that yet, or I've only seen that happen once. Can we do that together? And then we'll figure it out. So these are great comments. We haven't really asked these in previous trainings, and I'm glad I did.
I like a
Yeah,
lot.
they're hard to kind of stumble into an answer to some of these things, right? So if I'm giving any of you the impression that I know everything about IPS and every time I do a Fidelity review, it's absolutely perfect, let me just tell you secretly that I've made a bunch of mistakes and I'll probably make a bunch more. And I'm not looking for me or any of you to be perfect. I'm looking for you to kind of be prepared and know a basic level of what we're trying to do, and then collaboratively communicate throughout the process so that we all arrive at the best answer. So you have permission to make a mistake from Paul, Dawn, and Darren. So don't worry about it. There's plenty of other things right now to worry about. This is not a thing you need to spend much time on. It's great that you all want to do so well. I think that's awesome. And you will. So you got to give it time, as they say, right? There's no shortcut to experience. So that's really what this is all about. Yeah. Every reviewer I've ever talked with has made some call to a colleague or a text to a colleague like after day one because they saw something they've never seen before or they've never done before. And you'll get there too. But we'll provide all the support you need. So I don't want to say don't worry about it. I can't tell you how to feel because that's also the counselor in me. But you're going to be okay, is what I'll say. You'll be okay. Dawn or Darren, anything you want to add to that?
Well, I was just going to say I want to reframe a little bit. So we'll use another counseling technique. I've heard people say, I've heard people say, doing things wrong. And the way I want to reframe is not so much doing things wrong, but how can I improve? Mm-hmm. So for strengths-based, let's focus on, in the review, I tell the agencies, this is just you are where you are right now. You're going to get some feedback, good and constructive. And so there's no shame in being anywhere that you are. We all start someplace, and this is about improving from wherever you're at now. And so very much less the idea, did you do something wrong? Nope, you didn't. You did the best you could knowing what you knew, and now let's provide some additional information so you can do better. Yep. So that's kind of my reframe, is to try and move people away from, am I doing it wrong? No, you're not. You're doing what you know how to do, and we're going to talk about some best practice kinds of things that will help you improve.
Yep, and that's a good point, Dawn. Also to keep in mind as a reviewer that there really isn't a wrong way to do it. People either do things according to Fidelity or they don't. And if they don't do things according to Fidelity, that's up to the agency. So if the Fidelity Scale says, do, number one, number two, number three this way, and we get to the agency and they say, well, because of financial considerations or because of other things, we do them a different way. All that we get to say as reviewers is like, okay, I mean, that works for you, but if you want to improve your Fidelity score, this is what we would recommend, period. So, and
Absolutely.
so there's really, I mean, it's a really safe space as a fidelity reviewer to make a recommendation, because all you're recommending is that they get more in line with the fidelity scale. And at the end of all of it, it's up to the agency anyway. So I'm sure there are some agencies that after Paul leaves and packs up his little, backpack briefcase and puts his laptop away, I'm sure I walk out the door and get into my car and they say, well, thank God he left. We're not doing anything different. And that's okay. That's up to them. It's not up to me. Whatever. I'm not going to personalize any of that. I try, but on that note, I try to be a gracious reviewer and a good visitor and all of that. So I encourage you all to do the same. There's just no point in you'll know everything you need to do, and at the end of the day, I don't want to say it doesn't matter what the agency does, because it does matter, but it only matters insofar as how it relates to the fidelity scale. Everything else they have to do, I mean, at the end of the day, it's a business decision. So not minimizing the scale or any of that stuff, but these are businesses. They've got to meet a bottom line in order to keep providing services. So some of the things they're going to do might not be fully squared in fidelity, and we don't get to have an opinion on that. I do want to mention too, Paul typed in a question: when did IPS start and how did it work before IPS? Are there any other alternate programs or models used instead of IPS? So that's a big question, a couple questions there, Paul. So the first thing I'll tell you is before IPS, there were other supported employment models, sure, but there really weren't any that sort of ditched the readiness like IPS has. With old models, and I can say because I worked at the same organization I work at today prior to us having IPS, and then after us having IPS onboarded, it used to be that we'd all as clinicians decide when someone was ready to work. And if a client said, hey, I'm thinking about work, Paul, the first thing I would do is I'd say, well, you're not taking your medication, you're not drinking, and you showed up here and you obviously haven't showered in 4 days. So what I'm going to do is sign you up for the next 12 weeks. You'll be sitting in a group where you learn how to do job interviewing and resume writing. And then after that 12 weeks, we'll have you spend 6 weeks, doing skills inventories. And then you'll do another 6 weeks after that, trying to work on your sobriety in our substance use service groups. And then by the end of all of that, the person's not interested in employment because we never even showed them a job after all of that. There are different models. A lot of the different models that are out there are really relevant to sort of either different diagnostic populations or disability populations, or maybe not different, but maybe just a varied look at disability populations. And I guess here's what I'll tell you. IPS is the most well-researched supported employment model that there is out there. And the research resoundingly identifies that it is the most effective supported employment model, not just for people with disabilities, but also for people in general, as I said earlier about veterans.
Right.
It's a model that works. It's pretty commonsensical. They say a lot, the IPS model is kind of how you'd help a loved one or a family member look for a job if they identified to you that they needed help finding a job. And some of that pragmatism, I think, is why it works so well. So I'll put in a quick plug for you, Paul, to go check out the ipsworks.org website. They have oodles of research available if you're into research. They don't dwell a lot on what did the landscape look like before IPS, but there are some comparative research studies, and they're pretty easy to digest if you're not somebody who's into research, but they compare them to either no help, no supported employment, or other models. So you'll have a lifetime worth of reading there if you want. It stood the test of time, let's put it that way. IPS in Illinois, anyway, where I first learned about it, probably around 2002, when it really started to kind of enter into the conversation around Illinois. And our state kind of did an overhaul at the state level to make space for it in the Department of Vocational Rehab system. And we still have struggles today. There are certain counselors we work with that readiness, they're still in a readiness mindset. And we still have staff that, I hate to point a finger, but sometimes prescribers, they're trained that if there's a problem, I have a medication for it. And that doesn't really reconcile very well with a supported employment model that says you don't have to take your medications if you want to go look for a job. So, you know, there's a lot of continued education. Great question, but there's a bunch of resources out there for you, for sure. At this point, I want to just move into the Fidelity Review Manual on ipsworks.org and just talk briefly about some of these items that we're going to be scoring. We may or may not get through all of these today, and that's okay. If we don't get through all of them, we may quickly go through them tomorrow. I don't want to spend a ton of time on these, primarily because they are very, very available for you to read on your own. It'd be different if all of you were, you know, going to be Fidelity reviewers starting next week, for example. I might spend way more time on these. But we've had a great discussion today, and we've hit on a lot of the things that we're going to talk about anyway. But I'd really like to spend a lot of time tomorrow talking to you all about the Fidelity review process in general. And then tomorrow we'll also have Dawn and Darren chime in on how Washington specific sort of you know, parts of the process will look to you. So that'll be good for you. And then ideally after tomorrow, you'll have reviewed the items that are scored today. And then, like I said, tomorrow we'll learn all about the Fidelity review process. So ideally after tomorrow, at a minimum, some of those anxieties will be sort of allayed a little bit, you know, kind of calm down, and you'll have gone through the information, you'll have kind of talked through how it might play out, and so that you'll feel a little bit better. So after that, though, I think that's where things like observing Fidelity reviews is probably the next step for a lot of folks, just to see it being done by reviewers. And Dawn and Darren can talk about that at any time too, for sure, how, like, what the plans are going forward. So let's talk about the first Fidelity review item. So it's in the staffing section, and it's caseload size. So remember, I talked about how it's an average, right? So even though the item here says employment specialists have individual employment caseloads, period, and the maximum caseload for any employment specialist is 20 or fewer, I won't go through the rationale with you, but the way you score it, just getting right into the examples, is you calculate the average caseload for the employment specialists. And this allows you to have some balance, so that, you know, maybe one employment specialist who's been there, you know, several years and well seasoned, maybe they're covering cases while newer employment specialists are kind of getting up to speed. And so the person who's been there a while, the veteran, if you want to think about it that way, maybe they're the person in this first example with 25 on their caseload, so that the newer person can have a little less than 20 while they're getting their legs under them. But nonetheless, you know, you take the average of 25, 19, and 20, and the average is 21 people. So let's see here. I think the scoring, yeah, to calculate the scoring, add the number of people who are assigned, and then you average it here. That's what all of those words are. And you score it using the anchors. I'm going to find the, here it is. I'm going to find the Fidelity Scale and kind of flip back and forth between this. So this is the Fidelity Scale that I'm showing you right now. This is the Fidelity Manual I'm showing you right now. So it's good to flip back and forth. If you had this in a book form, the Fidelity Scale is in the back of the Fidelity Manual, so you wouldn't have to flip back and forth. But when I go to a review, what I usually have is a Fidelity Manual, and then I have, for each review, each Fidelity review I do, I have a Fidelity Scale like this that I print out just for that Fidelity review. And so what I'll do then is, this is where I take all my notes for this specific agency. I don't take any notes that are private health information or anything that's HIPAA related. I only take, you know, if I interview a client, I don't put the client's name, I put client says this, or, you know, et cetera, et cetera. I don't do anything like that. I want this is the kind of thing that I'm going to use for my notes. And so what I would do in this particular item we just reviewed, we averaged 3 different employment specialists caseload sizes, and if you remember, the average came out to 21. So that means right here, our score we would assign is a 4, because a score of 4 corresponds to a ratio of 21 to 25 clients per employment specialist. Now, you may be thinking, okay, well, what would be my recommendation? My recommendation would be that, you know, the maximum is 20 clients. That's the recommendation. So the organization, since they're over 21, probably needs to figure out, how do we shuffle the caseloads so that the average is 20, or there's also this argument out there, I can't tell an organization this, but if caseloads are higher than 20, there may be an argument for them to hire another employment specialist. If everybody's got 25 on their caseload and you got 3 employment specialists, 5 from specialist 1, 5 from specialist 2, 5 from specialist 3 equals 15 on a new employment specialist caseload. Now, again, that's a business decision hiring somebody, so I would never recommend it. But the Fidelity Scale is the Fidelity Scale. Maximum caseload is 20 or fewer. We give them a 4 because that's what the math tells us to do. And if the organization comes back at you and says, yeah, but why is it a 4? We think it should be a 5. We just show them the math and say, this is what the score is. We have to score you in this range because of the averages, period. It doesn't have to be, like I said, it doesn't have to be contentious or anything like that. And I think we've got a question, and after all this time, I don't know how to field a question. So Dawn and Darren, if you could help me with that, I would appreciate it.
Can absolutely help with that one. The scenario is, and this is based on Washington State only, so it's not anything else. AmeriGroup has told agencies not to close people if they quit showing up, to let them age off in regards to their authorization period. So the only people we consider inactive are those people that aren't coming in anymore, and maybe they've said they, don't want employment services right now, but you're keeping, no, excuse me, let me back up. They haven't said that they don't want services, they just aren't contacting you. And AmeriGroup says you have to keep them open until they age off. Those are the only ones that we would consider inactive. So it's to not penalize agencies for the AmeriGroup policy, if that makes sense. And then, yes, Hallie, it's the active clients. Did I, Darren, chime in if I did a poor job of explaining, because I feel like I fumbled up on that one?
No, I think this is, it is a little tricky with Washington. I think you did a good job, Don, because when I was running a program, I tried to close people's tiers, and it's a very difficult process. So we understand that here in Washington, we're operating under the foundational community supports and working with, a AmeriGroup TPA, to maintain those authorized tiers until they, expire. So we know there's going to be a few people, like you said, that agencies have tried to engage with, and they may still be on that client list for an employment specialist. So that's that kind of important information when we look at data and we look at caseloads that, people are aware and can tell us as reviewers, because if we just look at a page, we might not be aware of the situation going on simultaneously while the review is going on. So we really rely on the employment specialist and the supervisor manager to educate us about what the caseload is like.
Those are great points. And it's worth noting too that one of the things that's really good for a Fidelity review team to kind of check in on the organization with on day one is how they define things like active, inactive, because that'll come up in this particular item as well. So this is a good conversation to have. The other thing I'll note too is, as a Fidelity reviewer, you're really rating IPS Fidelity according to IPS Fidelity. So not to say that you discount the information that Dawn and Darren just shared, but at the end of the day, there's no space in the IPS Fidelity manual for state-specific differences, whether it's funding sources or whatever. And so it's just, and this is something that every state sort of struggles with in their own way, is, at some point, it's inherently good that IPS is in a state, period. So there's always going to be little wrinkles in how it looks from state to state, state to state. So it's just worth the discussion. I'll put out there too, the Fidelity Scale here, the Fidelity Manual, I should say, it doesn't really differentiate between active and inactive cases. So that's something that we all have brought to the table as providers. So it's just interesting. Now it has this sort of bulleted list here. Many IPS specialists keep both a caseload list of people who are participating in the program and people who do not regularly meet with them. It says they should have just one caseload list, and the following guidelines will help programs define caseloads in a consistent manner. So within the confines of these bullet points here are sort of how we can define, according to IPS Fidelity anyway, all those sort of wrinkles of active versus inactive. I was in a state one time that had a state sort of grant process that supported IPS, and the agency I was at had that had a particular name. Let's just, I don't know, we'll call it, I'm gonna call it, I'm gonna call it Fender, because I like playing guitar and I think Fender guitars are great. So the name of the program was Fender, for example, this grant that supported IPS. So this agency did IPS services for clients that were in Fender, that were kind of enrolled in that grant, and they also provided IPS services for clients that, I'm sorry, they did not provide IPS, they provided a different form of supported employment for clients that were not in the Fender grant. And so, as you might imagine, as fidelity reviewers, we had to really sort out. So if I'm here to do an IPS fidelity review, I'm here to review all of your employment work. So, they're sitting there telling us that I've got a caseload of 18 for non-Fender, but 20 for Fender. And so as fidelity review team, we really had to figure out, does that mean their caseload's 38, or do we only review the 20 that are assigned to the Fender grant? And it was very complicated and very tough to sort out. And we ended up kind of giving two recommendations, basically, that, so like, here's your sort of Fender grant fidelity score. And then if the Fender grant wasn't a thing and this is just how you did business, this is what your fidelity score would be. And it was significantly different, as you might imagine. So it's
nice
tricky.
way of doing it.
Yeah, every state is tricky and has its own sort of elements that are just part of how the infrastructure of it. And so it's not right or wrong, but that's just something the reviewers just have to sort out.
Well, there's a couple of good questions about, well, they're all good questions, but a couple of questions that relate to waitlist.
Okay.
One about caseload size, and then one about job coaching versus job developer in different positions. So 3 more questions that are kind of relevant to the moment.
Sure.
Although,
so the first one here, go ahead. Go ahead.
Whether you answer when we get to that particular fidelity item.
Yeah, we can just go ahead and try them right now. So the first one from Harrison here, what would you recommend for having only one supported employment specialist and their caseload is starting to get past 20? Would you recommend a wait list? So let me just answer these kind of as they come up. So so there's a lot of things you could recommend. So again, from a fidelity reviewer's perspective, I think there's a big difference between having a caseload of 21 and having a caseload of like 29. The details are important in this particular one. A wait list is an option. Some organizations do that. And like I mentioned earlier, some organizations really view caseloads getting over 20 as evidence they can provide to leadership that shows they need to onboard an additional, or at least a part-time employment specialist to support the extra caseload. But not everybody can just hire, willy-nilly, especially after the last 12 months, I think, that we all went through. So whether it's a reasonable recommendation or not is kind of up to the organization. So there's a couple options, I would say. And then I guess the third option on that too is some agencies have, let's just use that example, 29 people on a caseload. And while it's not a 5, again, if you remember that Fidelity is flexible, if they had 29 on their caseload and there's one person, they'd have a score of 3. Yes, that will impact their overall fidelity score, but it could be that they still have a score for the agency that is in line with fidelity. They just scored a 3 on this particular item. So for an agency, they may make no changes. And that's okay too. So don't get hung up on if it's not a 5, it's not a good score, because a 3 is a good score. And if people have to have a caseload of 29 because that's circumstances that's what they have to do, then that is fine. Again, it's not there for me to say good or bad. It's for the agency to decide, can we do it? So a lot of options there. And then Harrison goes on here, if I have some clients who are not really showing up and clients should I keep putting more clients on the wait or wait for the ones who are not participating to age out before adding more clients to the caseload? Some of this I think is an organizational approach. So my organization has sort of a policy and a procedure for what to do when people sort of start to withdraw from services. And we do have a particular item coming up, time unlimited support in the Fidelity items, that kind of gives you some guidance here. But at the end of the day, your organization, I know this is kind of a non-answer, Harrison, but your organization is going to kind of have to do what makes the most sense for your organization. We can talk more about that on break if you want to, or when we get to the other time unlimited items. Bobby says, so if I have 20 people on my caseload and 10 aren't coming in for services, what then? Well, again, it doesn't really say active or inactive in the Fidelity Manual. It just says the average of people on your caseload has to be, for a 5, has to be 20 or fewer. So I guess to specifically answer your question, what then? So if you're the only employment specialist, you'd get a score of a 5 because you have 20 people on your caseload, and that's the maximum. And you can see where a lot of this is up to how the organization maybe defines things, right? And at the end of the day, the organization is going to provide to you whatever they think the list is. So if I walk in as a reviewer and you give me your caseload list, Bobby, and it has 10 people on it, I don't even know about the 10 people that aren't coming in for services. There's no way I could know it. So this is part of what agencies get to identify to us. At least I'm not aware in Washington that there's like a central place, like Dawn, where a reviewer could go find out caseload sizes for any provider in the state. I don't think I've heard you mention that before.
Well, there kind of is. The AmeriGroup has a report that they publish that talks about, that addresses caseload size per employment specialist kinds of a thing. But it's not something we go back and look at. We don't compare it against the Fidelity Review. The Fidelity Review is the Fidelity Review, and we're looking at agency documentation when we're doing that. So it's not something we go and check and say, oh, this one says they have 25 per caseload and the agency's reporting 20. We don't do that.
Right. And,
I did want to
go ahead.
Relate to the wait list.
Mm-hmm.
That I think it's the zero exclusion item has a caveat that says if you have a wait list, that kind of is excluding.
Yep.
and so you can't score as high on zero exclusion if you have a wait list.
Yep, definitely. I was going to chime in too that state I had mentioned where they have like the fender grant and the non-fender work. Another tricky part to those reviews was that there was I don't even remember the name of it, but there was some sort of computer platform, almost like a portal, where every IPS provider had to go in and enter data. And as a Fidelity reviewer, the expectation was that prior to the Fidelity review, you would run reports in this portal and have all the information you would need for the organization when you showed up to the review. The organization wouldn't have to provide really anything to you. You would come armed with it. And it was a real bear because if the agency didn't update it regularly, as a Fidelity reviewer, you'd be walking in with a 6-month-old list for caseloads, and it was just a nightmare, as you might imagine. It was very difficult, very unwieldy. Rebecca put in here, my agency separates job coaches from job developers, so I work closely with the job developers as they find jobs for my clients as I work with them on other pre-employment needs. Has this set up been evaluated, and does this affect my agency's Fidelity score? So I would bet it would affect the agency's score. It may affect the agency's score. I think it probably a lot depends on, what you'd hear in interviews when you're at the agency. And so if there's an item, for example, that talks about vocational generalists, and it says that, basically there's evidence that each employment specialist does all of the aspects of the job search. So I would ask a lot of questions about, so what do the job coaches do when they're not job coaching, and what do the job developers do when they're not job developing, to try to get a feel for that. And I don't know that a setup such as this has been evaluated that I've seen. I'm sure, there are agencies that are set up in a similar way across America. And I want you to just remember that just because it affects your agency's score doesn't mean that it's bad. Again, every agency is a business and they have to do what they have to do. I'm not going to show up there and wag my finger at you or make a tisk tisk noise or anything. If that's just how you have it set up because that's the way it needs to be set up, then that's, you do you, and I'm just going to tell you how that setup relates to the Fidelity Scale, and then pending the final report, your organization will just get to make some decisions. Do we want to change it or not in order to increase our Fidelity score? And you all will hear me answer that and hear Dawn and Darren answer in that way over the next couple days here, because that's really what it comes down to is, the Fidelity Scale, while it seems like it's very prescriptive, it's a guide, and every agency can do whatever they want, or whatever they have to do. And our job is just to kind of like check the list, like is what you're doing IPS fidelity, yes or no? There's a lot of variability, right? You can have a bunch of things that aren't scored a 5 on the Fidelity Scale and still have fidelity to the IPS model, even though you have differences compared to an agency that, let's say, has a perfect score or something, or a very, very high score. And it's not wrong. It's not wrong at all. It's just that agencies have to do different things because of different arrangements, and at some point, everybody has to appreciate that a fidelity reviewer pops in once a year to take a look, and all of the other days of the year, the agency has to figure it out without the reviewers, right? So, I don't want to go so far as to say, the Fidelity Scale isn't really important to an agency, because it is if you want to provide good, high quality services that have great outcomes. But at the end of it all too, there's an awful lot of flexibility within Fidelity for folks.
Sure.
So don't get hung up on,
Sure.
I don't score a 5. Don't get hung up on that. It's okay. There are agencies that do great work that have scored a 1 on particular items, and that's okay too.
And I wanted to say too, Paul, that historically the state of Washington, prior to using IPS, had an employment rate for people with serious mental illness, because that's kind of what we're measuring at this point in time. Because 94% of the people being served by IPS have a diagnosable mental illness. So regardless of whatever the other challenges are that they have, that really is the population that we're all serving. They, in some ways, they have a diagnosable mental illness. And so historically, the placement rate was like about 14% of people with serious mental illness were getting jobs in the state of Washington. I just saw statistics related to IPS, and this is IPS throughout the United States where it's being used in the 26 different states, that using IPS, hopefully to fidelity, the placement rate is about 42.3%. Mm-hmm. So the bottom line is, if you use it to fidelity, you're more likely to help people get and maintain jobs. That's the bottom line. That's what we're hoping
Absolutely.
for. And
Absolutely.
it's proven in per the data that's what's happening.
Yep. And on that note, Dawn, I pulled up the PowerPoint slide deck. The fidelity scoring, when you add all of the fidelity items together, a perfect score is 125. But if you score a 74, you have fidelity to IPS. You have fidelity to the model. The lowest possible fidelity score is 74, and that's not bad. Anywhere between 74 and 125 means you have fidelity. And just because somebody's got good fidelity or exemplary fidelity instead of fair fidelity doesn't mean they do it better or anything like that. This scoring doesn't at no point in a fidelity review will we score an organization based on their employment outcomes.
Right.
So you could have a score of 74, which is the lowest score in the range of fidelity, and have tremendous outcomes. You could really rock it at getting people employed and keeping them employed. So fidelity is fidelity. Don't get hung up on the 5s on the scale. Everybody does. Every time we do this, Dawn and Darren and I answer questions that are similar to this. What if this happens? Or what if we have it set up this way? And that's okay. It's good for you to ask those questions because you're thinking like a reviewer. But don't get hung up on, well, darn, we're not a 5. It's okay if you're not a 5. In fact, there's what, 25 items on the scale, right? Or am I wrong about that?
No, yeah, we use the 25 item scale.
Yep, 25 items on the scale. So I'm a counselor, so take this math with a grain of salt. But if there's 25 items on the scale and you get a 3 on every single one, I think you're going to get a 75. Is that right? That's right.
Yeah.
Yeah. So there's a lot of flexibility for people within the confines of Fidelity. So I can't say enough. Don't heap your valuation of the work you're doing as good or bad based on any one item score, because it's only until you look at the totality of it that you really get a picture of where an agency's at in Fidelity. So if you're in an interview and somebody says something and the first thing that you think is, well, I remember reading that in the Fidelity Manual and now I'm gonna have to score them a 1, you have to manage your nonverbals, because I don't want to say it doesn't mean anything, but like it fits into the greater discussion as opposed to just the one item discussion. You'll still score that one item, whatever you have to score it, but it's not the end of the world. I mean, it's okay. There's still room in the scale for people to kind of rebound and have a good score for sure. And then real quickly, I want to mention here, Christy puts in here, can you talk about a wait list and how should that be set up as to not be a barrier? Dawn mentioned it. She identified it right out of the gates here. There is some specific language in the no exclusion item that we'll get to that talks about how wait lists are, how they're regarded with regards to scoring. And I'll tell you the same thing we talked about in some of these other questions. As an organization, you have to set it up however you have to set it up. So there are organizations that have wait lists because there's no other option for them. And they just tell us about it, and as reviewers we score it and we move on. And of course our recommendation is that you should really try to figure out a way to get rid of your waiting list, but the agency knows we're going to recommend that right out of the gates. I guarantee it. That is not a surprise recommendation. So those are all of the sort of things. You all are doing a really good job at asking questions that I feel like come up much later for some other groups we've been in front of, Dawn and Darren. Yeah, I'm very impressed with the questions, but don't get too hung up on it has to be a 5 or what. Like, it's okay. Even if you get a score of a 1 on caseload size and you got somebody with 41 clients on their caseload, you got to do what you got to do. And every organization has to do what they have to do. All we would recommend then as Fidelity reviewers is you really need to get that employment specialist help. However you can, even if you obligate half of an existing staff member to employment, that's better than, and those are discussions you'd have over your 2-day Fidelity review anyway.
Sure. And one of the things that I would mention too, Paul, is both Darren and I worked for agencies. Both of us carried a caseload. Both of us have gone through Fidelity reviews in regards to, or I should say, in addition to being now Fidelity reviewers. Both of us are available to do training and consultation with agencies to, help to teach about Fidelity and things you might consider. And so individualized basis. So keep in mind too, as you're asking questions, that if you ever feel like you want a training from us to get into more depth on a specific item or 2 or 3 or whatever, we're happy to do that too. Yeah,
that's a good tip. And you all have resources as providers in Dawn and Darren, so access them as it's appropriate. And then the other thing to remember too, and I know we've said it, but I'll say it again, as future Fidelity reviewers, there are also resources for you for that too. Now, none of us know it all, but chances are you do enough reviews, you start to see an awful lot of it. Darren and Dawn have seen it, and chances are there's some other provider struggling with it too. So that's just kind of the way it goes, I think, is what I've noticed. So that was a good, robust discussion about our first item. So what I think maybe is appropriate is we all take about, 8 to 10 minute break here, kind of exhale a little bit. I feel like everybody's anxiety went up a little bit and then came down. So get up and, walk around your house or office a little bit. do some stretches. Let's come back, like I said, about 8 to 10 minutes, and we're going to start moving through the Fidelity Scale, and you'll have more questions, spoiler alert, and that's okay. Dawn and Darren and I will answer them. And then we'll just keep moving through this today, taking break by break by break, and then I will see you in about 8 to 10 minutes. All right, I'm gonna just double check. Looks like we have a few more questions that have been added during break here.
This is a great group asking
Yeah,
excellent questions.
I
I am
agree.
impressed.
And I don't mean to impugn other groups, Dawn and Darren. I just think the level of questions here, and I'm not blowing smoke, the level of questions here is it's just a different level than I think we've had in the past.
Mm-hmm.
And that's
Well,
great.
and part of it may be that we're doing things a smidgen differently today than we've done. We're putting a little more emphasis on some things. And your question about what makes you nervous about fidelity reviews was just spectacular, I have to say. That actually really got the conversation going. So
It did. It kind of opened up the floodgates, didn't it?
it did. So go, Paul. We definitely need to
Wow.
ask that one again.
That's all my training as a jazz musician. No, it's shooting from the cuff there, shooting from the hip.
There we go.
Yeah, I thought that was really good, Paul. Got a lot of great discussion.
Thank you. I always wonder if there's somebody out there kind of chewing on their fingernails about all of this that we're talking about. So that was what really kind of stimulated it. Bobby put into the question bar there, I understand we need to keep them active, but if I have more time to work with more people due to some not seeing me, how does that work? Kind of the same that we talked about. At the end of the day, whatever an organization produces as the caseload list is kind of what we're going to regard in terms of that first item, caseload size. So each organization has the flexibility to put it together however they need to put it together. And I feel like I understand where you're coming from with this, Bobby. I mean, there are some people that kind of they show up and they're really ready to find a job and hot and heavy, and then after a couple weeks, when the job that they thought they'd get immediately isn't quite there yet, maybe they get other things happen in their life, they're distracted by other things, and so they start to taper off of a little bit. But those are the same people that I know, because I've done some of the work here. Those are the same people that 90 days later show up again hot and heavy, so like taking them off of your caseload doesn't seem as practical as keeping them on to kind of ride that wave. So I definitely understand what you're saying. And so I don't think Darren and Dawn and I are talking about the boots on the ground, this is how you should set it up, as much as we're saying this is how Fidelity views it. So I really want you to think about, with regards to kind of the questions you're asking about caseload size and active and inactive, not so much about what do I do or how does that work, but think about how does that work for Fidelity is kind of like the two words I'd add to your question. So for Fidelity, we're going to come in and look at your caseload, whatever the caseload is that the organization puts on paper in front of us. So if they're active, if they're inactive, we may not really know all of that detail unless you provide it. And so that, kind of becomes its own sort of, not to sound, what's the word? Not to have too much gamesmanship to it, but it kind of ends up becoming a strategy, I think, for providers is a good way for me to put it. So everybody that is on this call and every IPS provider in America right now has a portion of people that they're working with that are names on paper and they haven't talked with in a period of time. I will tell you that much. Everybody does. That's just the work that we're doing. So I think we're good on time to kind of get back at it. So I'm going to move into employment services staff. This is the second item under the services. Staffing, I'm sorry, I knew I didn't have it right. Second item under the staffing section. And this really just looks at employment specialists providing only employment services. We're going to get this information from interviews and from what people tell us, both the employment specialist and the supervisors. I'll skip over the rationale, but the idea is employment specialists work best when they're only providing employment functions. And if you go over to the scoring rubric here, what you're going to do is just try to arrive at a percentage. And in agencies where I always think the ones of the scoring and the fives of the scoring are always the easiest ones to know. Either something is completely absent, or it's there way less than it needs to be for a 5, or you can find no evidence that it doesn't exist, or that it is not there. That it's definitely there. So for this one, most agencies, you're going to have an employment specialist that works only on employment, and the case management type things that they do are really incidental, and they're related to the employment anyway. So you may find a note from an employment specialist, for example, that is taking somebody to get their ID card, which is, it's like a case management type function, but it's so that they can have identification for when they start their new job, that has a start date in 2 weeks or something like that. So in the context of employment, it makes a lot of sense that an employment specialist would provide a case management service because it's related to work. So that would be a 5, if that was the only employment specialist and that was the only thing they were doing. What this item really wants to guard against is somebody, let's say, maybe being a half-time employment specialist and a half-time case manager. And the reason that the people who put IPS together kind of wanted to guard against that is I think we know that if you're a case manager and let's say you've got a full day of, well, we'll just split it in half. Let's say in the morning you're scheduled to do case management work, and in the afternoon you're scheduled to do employment services work. What do you think happens when a crisis walks in the door from your caseload in the afternoon? You drop the employment services stuff to do the crisis. It's historically what happens with a lot of agencies. So we're really trying to just guard against, sharing time with other stuff, because it's we want employment specialists to work on employment. Places that have the best outcomes have it set up in that way. So I'm trying to think of other things. I don't think this one has any sentences that stick out to me that I had an asterisk by. So here in small mental health agencies, go ahead.
I'm sorry, Paul. I was just going to say, back when the 1915 B3 waiver went away in the state of Washington, and the agency that I work for decided to keep the supported employment program, which a lot of agencies didn't, they made me a case manager and said, your specialty will be employment. Mm-hmm. And I will say my real live experience was when somebody came in and their meds had been stolen, or they needed to go to the food bank, or they were going to lose their housing, or, anyone, the police was going to pick them up for some reason, or they were being abused against. All of those things took precedence because in the scheme of life, they were emergent and immediate, and I really didn't do any employment services,
Sure.
Truly none. Just really, all the other stuff took precedence. So yep. I can tell you from a real life experience kind of standpoint, it makes perfect sense not to do more than one job. It makes sense to do the employment specialist only.
Yep. And it says here in the Fidelity Manual, Dawn, to your point that, we understand that it says here, although the split position may be practical, the fidelity standard remains constant and is not adjusted for different situations. So again, the fidelity scale and the fidelity reviewers aren't judging whether or not Dawn's scenario is right or wrong. We're just saying, well, in regards to fidelity, we think it would be best if you were just focused on employment or case management, one or the other, not both. But at the end, like we said before, at the end of all of it, each agency gets to make a decision, right, based on the business that they have. So that one is fairly straightforward. And again, to calculate the score, you're really just looking for a percentage. This one may be a tough one for you to get a definitive percentage on, especially, believe it or not, especially in an organization where they have employment specialists that really don't do case management. But to be fair, I mean, when I'm doing a fidelity review and that's the case, I just kind of, after talking with them, if it's very clear to me that there's no other function they provide beyond employment, I just scored a 5 and I don't really worry about the percentage because it's hard. There's no real way to calculate it if you want to think about it that way. Where you'll really spend a lot of time discussing it and going back and forth on it and trading notes on interviews is when people are splitting time between, like Dawn said, case management and employment. You'll really ask a lot of questions about, okay, well, let's look at your calendar. How much time did you do, on Monday? What of this is employment? And you'll see 2 appointments. Okay, what about Tuesdays? 5 appointments. Okay. And then as you start to walk through a week or 2 of their calendar, you might be able to arrive at maybe a rough percentage of how much of their time is spent on employment. But beyond that, If you're interviewing somebody who's a case manager assigned to employment, chances are, they're not going to have a 5 or a 4. So you'd be kind of trying to exclude things in the 3 and the 2 and the 1 category to see which one is the best fit. Item 3 here is vocational generalists. And it says each employment specialist carries out all phases of employment services, including intake, engagement, assessment, job placement, job coaching, and follow-along supports before step down to less intensive employment support from another mental health practitioner. So there was a question earlier, right, about we have some people who are job coaches, some people who are job developers. How would we regard that in the Fidelity Scale? And so if you go to number 3 here, you're looking for each employment specialist to carry out all phases of employment. So basically, we would want to, through our interviews, figure out where this organization lines up in the scale of scoring here. So a 5 would be each employment specialist carries out all 6 phases. So in that example, we know that's not accurate. So then we just start walking it back from there. So do people do 5? Yes or no? If they don't do 5, do we think they do 1 to 4 phases? And maybe that's the most accurate. And please don't share any additional detail, because I don't want anybody to arrive at a score for their organization through this training. But just based on what was shared, we might start moving towards a 3, because it seems like employment specialists provide 1 to 4 phases of the employment service. And the questioning then would really be kind of confirming some of that, maybe really finding out, well, okay, so you do job development. What do you do when you're not job developing? And so that may be, well, I'll do, if anybody walks in today and needs a vocational assessment, I'll do that. Or so there's a second function. So you start to piece it together that way to arrive at a score, and it starts to kind of become a little bit more clear, I think, as you have the discussion with the employees. So this is a good example of something from our questions that you could roughly score today. And again, not knowing additional detail, of course, but the thing about the Fidelity Manual too that I think I neglected to mention that's very cool is it provides these examples of the way things might look in certain places and how you'd score it, and et cetera, et cetera, et cetera. So I think it's worth going through this. And this is not like a book you can pick it up and read it cover to cover in one sitting or in a couple sittings and expect to remember all of it or anything like that. So I'd encourage you to pick it up and maybe just start at, pick it up and read through one item at a time, and then just kind of make notes in there, or put a sticky note in there for questions you'd want to ask next time you see Dawn or Darren or Paul, and underline something, highlight something, whatever is going to make sense to you. One of the things that we'll note is it's got a great example in this one here of how you regard it when you have an organization where one employment specialist carries out all 6 phases, and a second one carries 4 phases, and a third one does 1 part. So the short answer is you score each individual employment specialist alone, and then you kind of put them together. And the reason I want to bring it up is we'll see this more often in the Fidelity Manual. If you get an item like this that scores 3.6, there are many, many places in this Fidelity Manual where the recommendation is actually that you'd score 3 and not a 4. It's not rounded up to 4, it's rounded down to 3, because 3 is the score. It's the score that they have satisfied completely. They have not yet satisfied all of the requirements to score a 4 until they get to 4.0. So even if you put all this math together and you divide it by 3 and it's a 3.9, you would round down so that you can give them credit for the score they have most completely met the criteria for. Does that make sense? I think everybody's muted, so I don't know if people are saying yes or if they're saying no, but if you have a question about it, please feel free to pop it into the questions bar. Just going to keep kind of moving through this too. So in the organization section, we're now in kind of the second section of the Fidelity Manual. Integration of rehabilitation with mental health treatment through team assignment. So if you remember in the very beginning, we talked about if you're working at an organization or you're doing a fidelity review at an organization that doesn't have a mental health treatment team, you're going to try to help them identify for you what is the most relevant team for their organization. I gave you a few examples, and there's a myriad of examples. Let's see here. Staff from clubhouses and community rehab providers that coordinate services with other mental health agencies may be unable to improve this score for this item. So if you're somebody who doesn't have a mental health treatment team, but you get referrals from an organization that's a mental health organization, fidelity reviewers might be asking you, do you interact and integrate with that team, even though it's an external agency? And that's going to be really hard for you probably because it requires that organization to kind of accept you into their milieu. So that gets to be a tricky part. The examples are the best part of this item. Fairly straightforward on the first one. An agency has 3 mental health treatment teams and 1 IPS specialist. The specialist attends each team meeting and receives referrals from all 3 teams. 30% of their caseload is from the first team, 30 from the second, and 40 from the third team. The score for this item is 3 because 70% of the people on the IPS specialist caseload are from 2 mental health treatment teams. So the reason that's important, I know there's a question out there. This item says kind of 2 things. One is that employment specialists are part of up to 2 mental health treatment teams. And the second portion is from which at least 90% of the employment specialist's caseload is comprised. So if they're connected to 3 teams and they have 90%, they're still not going to get a 5. In that example, now that I've given myself that example, I got to figure out how would we score that. So they'd get a 2 because they're attached to 3 or more treatment teams. So what seems like could be good based on 90% of the referrals coming from the teams, because they're assigned to more than 2 teams, kind of defaults them to a 2. This is why having the Fidelity Manual present while you're doing a fidelity review is really important, because it helps you frame up all of these different ways it could happen. Let me do one more example and then I'll flip over to the question here. Here's a good one. Clubhouse provides evidence-based supported employment as part of its array of employment services. In general, clubhouses do not provide mental health treatment, and at this clubhouse, the 3 IPS specialists are each assigned to 2 mental health treatment teams at a nearby mental health center, from which 90% of their caseloads are comprised. Reviewers score a 5. So this is a good one for you to know too, because this particular item on the Fidelity Manual scale, it doesn't regard anything like the frequency of team meetings or anything like that. That's actually scored in another item. This really just counts how many teams are you assigned to and how many of your referrals come from those 2 teams. So another good first day activity is for you to have the organization help you understand exactly what the teams are. There's a lot of times it's really blurry how the teams are organized, and they'll call different teams different names, and sometimes the same team a different name because it's part of a bigger team, et cetera, et cetera. So you really want to spend a couple minutes just really understanding how's everything organized, who reports to who, and that sort of thing. Let's see here. Harrison says, assuming they are, but just wanted to double check for clarification. Are the supported employment and supportive housing programs checked under the same fidelity? So first question, I'll stop right there. So supported housing has its own fidelity scale, which is different from IPS supported employment. And I'm sure Dawn and Darren can provide some insight onto that one. And then also, if scored differently, will the fidelity scores from one program affect the other? Short answer on that one is probably maybe. So in an example, where instead of a mental health treatment team, somebody's working with an employment specialist is assigned to a supportive housing treatment team. If they're assigned to a supportive housing treatment team, but less than 90% of the referrals come from that team, that would affect the score. There's a couple other items we'll get to about frequency of meetings and that sort of thing that it might affect it in that way. But Dawn and Darren, I don't know if you want to chime in on how supportive housing is kind of scored differently with a different scale in Washington.
Yeah, this is Darren. I can just jump in that they're both SAMHSA evidence-based practices. Definitely with WestStat and IPS, it's a different rigorous model with more academia-based. I have not gone through the supportive housing review process, so I'm not really familiar with that, but the originations are both evidence-based out of SAMHSA, and there's definitely more information there as well. But then WestStat and IPS definitely has a lot of additional researches and ongoing research, right now, process to continually hone in the IPS model.
Definitely. I think I saw one more question pop in. Can you define what you mean by teams? I get 100% of my referrals from my same agency, but get referrals from the different departments like our therapy, SUD, and our case managers. Will that put the fidelity low for the program? So great question, Harrison. These are real examples here you're providing, and so let's just use those. So I don't define the team. The agency defines the teams for me when I come in. So I'll just use your example. So let's say you get 100% of your referrals from these three teams: therapy, SUD team, and case. I'll just say case management. In this scenario, if these were all real, you would get sort of in this area here, you would have more than 90% of your employment specialist caseload comprised from the teams that you're associated with, but you'd be part of 3, it sounds like, mental health treatment teams. So this is similar to one of the examples I gave. So we would have to score it here. Employment specialists are attached to 3 or more teams. And it's not good or bad. I don't want you to think that. So if you just walk it backwards, we have to say, can we score at this? So can we score at a 5? Employment specialists are attached to 1 or 2 mental health treatment teams from which 90 to 100% of the employment specialist caseload is comprised. We can't score at a 5 because you're attached to more than 1 or 2 treatment teams. How about, can we score at a 4? Well, the only thing really changed here is the percentage. It's still 1 to 2 mental health treatment teams. So we know you're attached to 3. And this is Paul, even though I'm using brought up. So I'm not saying this is definitively your score. And how about, can we score at a 3? Well, again, the percentage changed, but not the number of teams. This one still says 1 to 2 mental health treatment teams. And we know there's 3 in play. So this walks us all the way back to 2. Employment specialists are attached to 2 or 3 to 3 or more mental health treatment teams. So only based on information you shared, I would say without anything else, I couldn't score higher than a 2 because that's the confines of the fidelity score, if that makes sense. So what I would do is I would come into your organization, anybody's organization, and on day 1, I would say, okay, great. So, Harrison, talk to me about, who's the employment specialist here, and who's the IPS supervisor, and does the IPS supervisor report to somebody, and if so, who's that, and are they a member of the executive team? And real quickly, I'm starting to put together like an org chart of the organization, so I know kind of how everything's assembled. And maybe in an individual interview with you, Harrison, we'd be talking and you'd be telling me how you do your job, and you'd kind of identify that, let's say I'm attached to 3 teams: therapy, SUD team, and case management team. But then let's say that you tell me the therapy and case management teams, they both report to the same person and they both meet together as one team meeting. So in that way, I might tell you, like, I think we should consider that 1 team instead of 2, because they meet together, they report to the same person. So it'd be different, I think, if you went to a therapy meeting, you went to an SUD team meeting, and then you went to a case manager team meeting. And again, not good or bad, but it is just the way an organization would be set up. So great question. The other thing I want to point out again is these sample questions. So for those of you that were kind enough to kind of express some of those anxieties earlier about, I'm afraid I will say the wrong thing or not get the right thing, it's got these sample questions there. So when you're talking with the IPS specialist, you can just ask these: who refers people to you? And they give you an answer. Okay, anyone else? So, and then one of the appendices of the Fidelity Manual is literally just a full gamut of questions by entity. So like you'd have IPS specialist, and then let's say about a page worth of potential questions you could ask them. And it even walks it over into which item on the Fidelity scoring sheet it corresponds to. So they make it very easy, I promise. I don't have any sort of super wizardry that I possess and you don't possess, and no offense, Dawn and Darren, but they don't either. All that's happened is they've gone through something like you're all going through right now, and they've observed a bunch, and the training plus the observation has led them to try out Fidelity reviews, and it's just all about experience and what you've seen, and kind of getting the reps in, if you want to think about it that way. So you all are equipped to do this, I promise. This is another one where you're going to round down. So if you do any sort of averaging, because you determine the score, this is another one where you determine the score for each employment specialist and then average it. So if you get 3.6, you have to remember you can't round up to 4. You got to round down to 3 because that's the closest one that they've fully met to score them fairly. Now, another way to look at integration here is with this item 2, integration with the mental health treatment team or relevant treatment team through frequent team member contact. This one is one that's like a lot of others here. They have to meet certain criteria that they've articulated in these bullet points. And so basically for each bullet point, they're going to get a point. So they'll get a point if the employment specialist attends the weekly mental health treatment team meeting that they're assigned to. So you would not get this point if the treatment team meeting doesn't happen weekly. You would not get credit for this point if, yeah, well, that's a good one. I'll stop right there. I'll make it more confusing if I keep going. So yeah, if the team doesn't meet weekly, you'll see in a few minutes here, we don't give full credit for this because they don't meet weekly. Second bullet point, the specialist participates actively in treatment team meetings with shared decision making. The employment services documentation is integrated into the client's treatment record or chart or medical record. The office is in close proximity to the treatment teams that they're assigned to. And the employment specialist helps the team think about employment for people who haven't yet been referred to the supported employment team. You're going to get this almost exclusively from interviews and observing treatment team meetings. And the idea is, like you might imagine, people work better when they work closely together. Like everything seems to be a little bit more effective. So let's see here. They break it out into the components. So other things for you to know: if the treatment team meets daily, it's recommended for high fidelity that the IPS employment specialist attend 1 to 2 meetings each week at a minimum. So if they're attending daily, that's great, but there's even a little flexibility there. The agenda can affect the score. So if the teams don't really, if they just leave IPS as an agenda item, that's not really rising to the level of let's see which component. Yeah, this component right here, participating actively in treatment team meetings with shared decision making. The idea here is actually, I think this is easier to look at on this sheet. It's got the 5 key components. If IPS is an agenda item, or if there's time, there's a report out from IPS, but there's really no shared discussion about how employment can help somebody, whether they're open to employment or not. We would want to be cautious about awarding that point. The documentation is interesting. Some organizations have electronic medical records, some don't. Some have a hybrid where they have electronic medical records, but they also have paper charting. And so this can be a little convoluted to try to sort out with organizations. So that's worth noting. And you would find that certainly in like chart reviews and that sort of thing. Employment specialist office is in close proximity to or shared with their treatment team members. This doesn't have to be all day. So for organizations that have multiple sites, in a geographic area, it's okay for an employment specialist to have like office hours, like on Tuesday afternoons, they're at site B, but the rest of the time they're at site A. The idea here is that they're proximal and available at some point when there's a referral. And we can talk more about that if folks have questions. And really the toughest one to see, I think, is that the employment specialist helps the team think about employment for people who haven't yet been referred to supported employment services. And the best way I can kind of describe this to you is just to give you an example. I was on a Fidelity review and watching the treatment team meeting happen, and I think it was a therapist, was talking about a client who wasn't showing up for their appointments, and they were kind of ventilating a little bit about how the person's really not going to go very far in treatment if they can't even get into sessions. And the employment specialist asked, do you know why they can't, like why they haven't been showing or why they don't attend your appointments? And the therapist said, well, they said they don't have money for bus fare. Well, what do you think the employment specialist said? Well, they said, I can help, right? I can get some money in their pocket so they can get a bus pass by helping them find employment, which is exactly sort of the plan that was hatched in that meeting. And so it was a great example, very organic, of how the employment specialist helped the therapist think about how employment could help when they haven't even considered, employment being something they would recommend to the client. So worth noting. So there are some questions here. Let me see here. Aaron says the questions that they have are amazing. They even have ones to question family members of clients. Yeah, exactly, Aaron. So like they make it really, really easy. There's a whole appendix just on potential interview questions you can ask. And what happens is you'll lean on those in the beginning as you're kind of developing your voice as a reviewer. And over time, you'll kind of figure out which questions are kind of like which is your script. You'll figure out which ones work for you and sort of in your interview style. With these meetings, how are we factoring in COVID? Are we expecting weekly Zoom meetings? Great question. I don't know that there's specific guidance that I could show you that says, yes, that's what we would do, but certainly, I was telling Dawn, I think it was last week, Dawn and Darren, that I've not actually yet been on a virtual Fidelity review. I haven't had the opportunity yet, but at the end of it all, I mean, some of the stuff virtually in a Fidelity review, you're just not able to really get a good bead on. This may be one, especially if an organization doesn't have the capacity to allow you to see virtual meetings or something like that. But I'd go so far as to say too, if you have meeting minutes, even if they're real basic meeting minutes that show the frequency of the team meeting and who is invited and how often they attended, I mean, as a Fidelity reviewer, especially right now, like that would work for me. And if the minutes aren't sufficient for me to kind of really get a bead on, the participation that IPS had, then I think I would ask questions of IPS in that interview, and I'd maybe ask questions like if I was interviewing a case manager that was in that meeting, like how often does IPS talk about IPS? Do they talk all the time or just an agenda item? So I think that's another way to think about it too, is kind of old school meeting minutes can also work. Will email communication count during this time? I don't know that it would count for this item, Aaron, alone.
Well, and I will
maybe.
that
Go ahead.
the WestApp folks have so once again, that ipsworks.org website, .org, WestApp's put out a communique related to some of the ways that they would see agencies accommodating during COVID. So I'm going to encourage you to some degree to go to that website and look up things like that actually on the website. And then there's some ways that we've kind of worked with things that are Washington specific. But certainly going to that website and reading what they have available is definitely a good thing to do at this point in time. If we're talking about meetings, we're talking about meetings. Yeah. And whether they're Zoom or whether they're something else, we're talking about a meeting. And so at least from my standpoint, and as Paul has said, we all have our own experiences and things, but the way that I read it, they're really talking about a meeting. Mm-hmm. Does that make sense? Does that seem viable?
Yeah, I think it makes sense. And I think the last 12 months are, I mean, there's no playbook, right, for any of it. And so I'd even consider like an old school phone conference, like a conference call.
Sure.
Like that would count for me, and that would make sense, especially during, it's not like, maybe it's different pre-COVID. They were doing different things, and that's okay too, and good context to know. But I think everybody's been kind of running around using their reptile brain for the last 12 months. So, we'll just adapt and do whatever. And if an agency, and it's all good faith, if they can say, well, here's what we're doing because we can't meet. And I don't know, I mean, you just think of whatever bizarre thing anybody could come up with. We pull our cars into the parking lot and, yell at each other out the open window. Like sure, I'll count it, whatever. Especially in the last 12 months. I mean, great. Is it something that could be sustainable? Probably not. But, for the purposes of what we're trying to meet here, awesome stuff. I mean, that's great. Yell at each other out the car window. Great. I love it.
Good question. Well, and even, some of the items have caveats for, do you work with an agency that has a lot of rural sites? And it talks about, maybe all the way along you've had to do, Zoom meetings or something. Well, they don't say it that way, but virtual meetings because your offices are too remote in order to get together with that kind of frequency. So That's the other interesting thing about the manual. You mentioned in close proximity to. And in a review one day, we looked up the definition of close proximity to, that one bulleted item in in the Fidelity item. And what it actually says is, if it's a multi-story building, the IPS team should be on the same team as the agency's referring, or the same floor, as the agency's referring to them. So it went to that level of specificity. If you got a 3-4 floor building and IPS is on 2, then the teams referring to them should also be on 2. Kind of amazing.
And it's I mean, some of this almost seems on its face value like it like people got together and started twisting their mustache and saying, how could we really stick it to providers and make it difficult? But the reality is, behind the scenes, I think the reality is what we know about a lot of other things too. When you look at like the integration between federally qualified healthcare clinics and mental health centers, the research that's available out there, one of the things they recommend as a best practice is what they call a warm handoff, where if somebody's in Dawn's office seeing Dawn for, let's say, a sore throat, and they reveal to her that like they are going through something and they need some help with their anxiety, the best possible scenario is Dawn could take them and walk them down the hallway and sit in my office, and we could talk about that anxiety that day, that minute, as opposed to scheduling, so on and so forth. And it's the same sort of rhyme and reason that's behind that proximity item, is that it's one thing to make a referral. It's another thing to be able to say, hey, Dawn, I want you to meet, Darren that I've been working with. He told me today he's really interested in looking for a job, and I told him, that's what you do, that's all you do, and like you're really good at it. Do you think you guys could have some time to connect? Because that sort of managing up of our colleagues and our coworkers and kind of meeting the need in the moment really goes a long way towards making a good connection with clients. So if it seems absurd, it's only because there's some science behind it, is my experience with the IPS Works people. They're not into willy-nilly recommendations. They're into let's do the research and see what works, and then that's what we'll recommend.
I do see Bobby had asked a question about what about meeting more than one client in a meeting. And I just wanted to kind of make clear too, each of the FCS agencies is dealing with expectations from AmeriGroup. They're dealing with expectations potentially from another referrer. They're dealing with, kind of IPS fidelity expectations, if you will, or recommendations, I should say. And so sometimes the lines blur between, is this question really related to IPS, or is it related to maybe AmeriGroup and being able to bill an activity or things along that line? And today we're talking about IPS. So, and Bobby, maybe you could clarify a little more, kind of what your thought process is there. But I just wanted to throw that out because it seemed an opportune time that both Darren and I, when we talk to agencies, kind of help them delineate, is this IPS related or is it something else? Because if it's something else, then, we need to have an entirely different conversation. If it's IPS, we can relate it back to the standards.
Yep, and I'd also add to that, Dawn, that most team meetings I have observed during a fidelity review are not like administrative team meetings like, hey, everybody, don't forget, United Way donations are being collected till the end of the month. The team meetings are what I would describe as sort of like clinical interdisciplinary team meetings, and they are talking about more than one client, and they're kind of talking about it almost from a high level programmatic, go around the room, who's struggling this week, and what can we do to surround them with care and provide wraparound services to help support these clients. So I think more often than not, the team meetings that I see they're talking about multiple clients in one meeting.
Yep, absolutely. Good point.
So let me stop right here for a quick second. It's about 6 till. Is this the break where it's lunch for you all?
Yes.
Okay.
Yeah, the plan is to lunch break where we will leave this open.
Oh, definitely.
But I'm assuming we'll all just mute ourselves. And so, if somebody comes back early and wants to type in a question, they're welcome to do so.
Yep.
But we wouldn't return until after the break was over.
So maybe it's good to just kind of put out there, like how long of a break is appropriate, and I'll let this group kind of tell me. I'm good with whatever. So I think I can't remember, Dawn, how long we did a break for in previous training sessions.
I'm glad I'm not the only one that can't remember.
Yeah, it seems like a lifetime ago.
Certainly anything between 30 minutes and an hour would be acceptable. Maybe say 45 and split the difference.
Yeah, I can do 45. Well, let's do this. If we break right now and come back at quarter after the hour, that'd give people, an extra 5 minutes to kind of either walk to the refrigerator or do wherever they need to go to get a bite to eat or stretch their legs. So we can just kind of reconvene at quarter after the hour. Like Dawn said, I'll leave it up and open. I'll just mute. So if people do have questions, you may see me answering during the break, and same with Dawn and Darren, I'm sure. So feel free to, use this time to either flip through the manual or take a complete break from Dawn and Darren and I. That's okay too, no judgment. And we will just reconvene at quarter after the hour. How does that sound?
So we're taking a 20-minute break?
12:45, what I'm hearing you say.
45, yeah.
Yep.
Yeah.
Oh, I'm sorry.
Okay.
I'm sorry, 3/4 after the hour. Did I say quarter after the hour? What's wrong with me? It's been a long week already, unfortunately. Yeah, so 3/4 after the hour, we would reconvene. Holy moly.
That sounds perfect.
I told you guys, I'm not the math guy. I am the counselor. So don't trust me for any measurements or math.
I resemble that remark.
Okay, everybody.
And
I will talk to you in a little bit. Oh, go ahead, Dawn.
I was just going to say real quickly, I have another obligation from 1 to 2, so I just wanted to say thanks to folks for being here today. I'm not going to be after the lunch break. I've got to go to a regularly scheduled meeting that was scheduled long before this, so I apologize for that. But thank you all.
It's good to talk with you, Dawn.
Thanks, Dawn.
Yep. All right, we will see everybody tomorrow in a little bit. Yep, talk to you tomorrow. All right, it looks like we have some people back already.
I'm with you, Paul.
All right. They've got that little sort of icon that shows whether people are have this pulled up as the first window or whatever. So I'm kind of going based on that. It looks like there's still quite a few folks that are, I'm guessing, away from the computer or whatnot.
Yeah, I would say so.
So we'll just give a couple more minutes. We especially with another day tomorrow. So. See any new question chat box either, the box.
I don't see any since the lunchtime.
Maybe everybody was so disappointed that I didn't know how to tell time that they couldn't think of any questions.
Well, I think they're overjoyed with the extra long lunchtime.
Sure. Makes sense.
Yeah, I made a command decision that I should not, I guess. And I forgot to log off, so I'm going to do that.
Oh, all right.
We should have asked the team if 45 minutes would work for them, huh?
Yeah.
Yeah, well. Bye.
All right. See you, Dawn.
Off.
Just wait a couple more minutes. Maybe one more minute. We're starting to see some folks. Okay, I think I am going to go ahead and get started and just kind of let people join, as they get back in. So it's a nice long break, right? Good. Just as a reminder, if folks do have questions at any time, please go ahead and just pop them right into the questions box, and we will try to get them answered for sure. I think we left off on item 3 here, collaboration between employment specialists and vocational rehabilitation counselors. I'm going to flip over to the Fidelity Review Manual for this one. Really, I think the main point here is that, again, agencies with great outcomes tend to have very frequent contact with vocational rehabilitation counselors. Part of the Fidelity review process is to interview a vocational rehabilitation counselor, assigned to whatever organization you're at. I also know from doing these prior with Dawn and Darren that in the state of Washington, got to think of the right terminology. Is it order of selection that state of Washington is in?
Yes.
Okay, so I know that's also sort of a game changer, for lack of a better way to describe it, for the state of Washington. Nonetheless, like we've talked about with a couple other items in the Fidelity Scale, as a IPS agency, you're still going to be reviewed on that. And as an IPS Fidelity reviewer, you're still going to review organizations on their collaboration with vocational rehabilitation. And as you scroll through this in the Fidelity Manual, this one gets pretty prescriptive. Let me flip over to the Fidelity Scale. The Fidelity Scale when I say it's prescriptive, what I mean is to get a 5 in this one, it says employment specialists and VR counselors have scheduled face-to-face meetings at least monthly and have client-related contacts, which they're including here as phone, email, or in person, at least weekly to discuss shared clients and referrals. So it's already been, I think, made pretty clear to me that for most organizations in Washington, having a 5 on this in a fidelity review might be difficult to attain. And I don't know what to say other than I sympathize with you. If you step out of a provider role and step into fidelity reviewer role, I don't want to go so far as to say like order of selection doesn't matter or anything like that, but you're really viewing the collaboration between VR and employment specialists in a real narrow circle. So it doesn't consider a lot of factors like order of selection or in organizations where there's some distance between you and your closest VR office. It doesn't really consider things like that. And so I just bring it up to say that I know this might be a challenge for a lot of you on the call and at a lot of organizations you all would do a fidelity review at, but it doesn't change kind of how we regard it. And so, Darren, I don't know if you've seen any, if you have any comments, I suppose, on this particular item regarding fidelity reviews you've already completed that you could add to this. I'm trying to be delicate. I don't want to paint it like, VR is a problem because I don't think that's the case at all. But
no, there's some agencies that done a very good job of that kind of coordination virtually, and I think VR on their side has also made some accommodations. Again, I think with any state agency, COVID has really created some barriers to get those connections and maintain some of that weekly and monthly contact on both sides. It's just been difficult, and I think even some more rural sides of Washington, I've heard it's even been more of a challenge because there may be no one, at the satellite offices or very limited exposure in their office for VR staff. So I wasn't sure if the manual had anything about rural characteristics because sometimes the nearest VR office could be 80 miles away.
Right.
For agencies.
Let me look here. I don't think I remember anything specific to rural.
I've seen rural come up a couple of times in different elements, and I was just thinking, I was wondering if there was something there, but definitely I've heard agencies do a really great job of doing virtual, Zoom meetings with the VRCs.
Sure, and we've learned so much from our response to the pandemic. I mean, that may be the kind of thing, Darren, that we take a page from our transition to virtual services in an effort to really provide a solution to organizations that have some distance between them and a VR office, for example.
Absolutely.
I mean, a lot of organizations I'm aware of that formerly didn't have any real plan for virtual contact had to develop it pretty quickly over the course of the last year. So, and I'm thinking too, like state agencies, we didn't have any in Illinois, for example. Our state agencies that we talk with didn't have what I would call a real robust variety of virtual tools they could use, at their disposal. They had maybe some WebEx meetings or go-to meetings, but certainly not the kind of thing we can do now where we can just do a video call with anybody in the Division of Mental Health, for example. So I think as our industry kind of learns from everything over the last year, solving some of those issues like with either rural providers or other stakeholders that are rural that we need to connect with, that's just one more tool in our arsenal to try to satisfy it. So again, this one's pretty prescriptive, pretty straightforward, not a whole lot of noise to it. This is pretty simple. It just measures how often, the frequency by which you meet with VR. If we move into the next one, it's vocational unit, and the Fidelity Scale defines a vocational unit as at least 2 full-time employment specialists and a team leader. They go further to say that there's weekly client-based group supervision that identifies strategies and job leads are shared, and that the team provides coverage for each other's caseload when needed. And the rubric over here is pretty simple. Basically, it's varying degrees of each of those statements. if I flip over to the Fidelity Manual here, you're going to get this in interviews with the IPS team and observing of the IPS team meeting. Let's see here. The examples are really where it's at. IPS specialists, for example, the second example, IPS specialists meet weekly, but the focus of the meeting is to discuss administrative issues or quickly provide an update on each person they serve. The score is not higher than 3 because the purpose of the meeting is for team members to support each other by generating possible solutions, sharing job leads, and celebrating successes. If we pick a different one, a small agency in a rural area has just one IPS specialist position and the supervisor does not carry a caseload. The score is 1. Reviewers explain that it is difficult for an IPS specialist to work without another IPS specialist to help problem solve, share job leads and responsibilities. Unless the agency serves fewer than 60 people with serious mental illness or other condition, I would imagine. Reviewers encourage the agency to add another specialist position. And that is in line with the rubric here, the scoring rubric here. So 5 is exactly, it's exactly what the definition is. There's no difference in the language. A 4 then would be at least 2 employment specialists and a team leader have 2 to 3 regularly scheduled meetings per month. And if you remember, the definition said weekly group supervision. So you'll see this a lot in the Fidelity Scale. The gradient between 5 and 4 is a change in a word or a couple words. So it's gone from now weekly to 2 to 3 meetings per month. And then there's an or if there's a rural area, et cetera, et cetera. So really read through these scoring rubrics as you're going through these, because the nuance to the language between a 5 and a 4 or a 4 and a 3 is really important to kind of pin down. Okay, so I see a couple questions. I'm going to take a quick pause. So Harrison says it's been a big challenge to get in communication with DVR during COVID. I live in a more rural area myself, and the only way to contact is through the phone. So most of my messages get piled up and don't get responded to. Trying to still contact them, but COVID has really thrown a wrench in that communication. Harrison, I know there's no question there, but I think you're right. I think it's a challenge. It's been a challenge for a lot of organizations in general. And our friends at state agencies are no different. And sometimes, I'll just tell you anecdotally, I've heard from my friends that work for the state of Illinois, sometimes the bigger wheels move a little bit more slowly. I know in Illinois, their response to transitioning to virtual was much slower than most individual provider level agencies. And a lot of that is because while they may have at the state level the money to make a change, the number of decision makers that have to get involved and in order to make an amendment to a spending plan, exponentially greater than your average organization. So keep trying, cut your partners in DVR some slack. I've been saying for about 12 months, I think the one thing I've learned very much in the last 10 to 12 months is that this is a great time for us all to just kind of give a bunch of grace to each other. I don't think anybody's operating at 110% efficiency or capacity. Just again, speaking from personal experience, it is so easy right now to make mistakes and overlook things, and so keep trying. You're doing the right thing by trying. You can't control the outcome, so it doesn't stop you from trying. Rebecca here writes in, because the FCS program, which follows the IPS model, only offers 30 hours of support every 6 months, we rely on DVR for clients who have more intensive needs, and I have found that DVR is running so slowly and is so embedded in the idea of workplace readiness that it actually has presented barriers to the efficacy of our FCS program. I used to work as a DVR counselor, and I feel that there could be a lot of improvement in the structure and policies within our current state's VR process. You are all blessing me by sharing these comments and not asking me a direct question about your state's DVR programming. I thank you all for that. Rebecca, I don't know the specifics beyond what you've shared about DVR in the state of Washington. I will tell you that Darren and Dawn have, over the course of the FCS project, really spent time trying to develop a collaboration between what we're doing and something like this with DVR. We've had folks from DVR at several of our opportunities, trainings, if you want to think about it that way. So I think there's some want to there, just based on what I've seen. and beyond that, you know, I can't. I'm not sure what to say beyond that.
Well, I'll just jump in a little bit. There's definitely
Sure.
been a lot of change in DVR. Even the leadership has changed quite a bit over this last year. And then you add COVID and people working from home. It has created a lot of challenges. And I know even before COVID, order selection was definitely another challenge. But, you know, DVR, we do have kind of IPS liaison, Katie Merkovich, and she's been with us in programs. And she is working really hard to really, you know, advocate and, you know, weave the theme of IPS, supportive employment services throughout the state. So I think there's some counselors who are all counselors. I think all in-state employees are working incredibly hard right now. But I also know that I have heard from other agencies, things have really slowed down in terms of referrals and making progress. And in addition to with FCS, they do have the ability, you know, to reauthorize folks for extended services. So we're really fortunate to have some flexibility with the Mayor Group and FCS to continue some of those much needed services, because everybody is really providing a very critical element of supporting many clients across the state to change their lives and create opportunity of employment. So definitely DVR, this healthcare authority, we're all on that same messaging and to change people's lives through employment. But I know from other agencies, it has been a challenge. Oh, are you still there, Paul?
All right, how about now? Is that better?
Much better.
Okay, somehow I muted myself without knowing how I muted myself. I was just saying, I've worked with Katie in the past over the last couple of years, and it's she's a tremendous advocate for IPS, and I think it's
Yes.
awesome to have. It's a real advantage to have Katie kind of doing her work from that side, and all of us kind of doing this work from this side of the spectrum. So if things have slowed down, don't take that to mean that there's a lack of focus. I guess what I would put out there too. I think DVR is still very, very interested and committed to what we're talking about.
Oh, very much so.
Jordan also typed in here, what if I'm the only employment specialist and the organization has less than 60 people, but I have the ability to communicate with other employment specialists when needed within the organization, but do not meet with them weekly, only when needed? So great question, Jordan. This is, so if you were in an interview with me during a Fidelity review, this is the kind of thing where I would ask some follow-up questions. So if you remember, if we just look at it from this item only, we're looking to see that the organization you're working at has at least 2 full-time employment specialists, which it sounds like they do, and a team leader. And so your comment didn't really shine light on whether there's a team, like an IPS supervisor. And then we have to look for, if we look for that first, the people, and then we look for the process. Is there weekly client-based group supervision following the supported employment model where we identify strategies and job leads are shared? And are you able to provide coverage for each other's caseload? So based on what you shared with us, and I'm really cautious, you know, if you all provide examples to us, you know, I'm not going to ask you for follow-up information. You're certainly welcome to volunteer it, but I don't want to get into a situation where you guys are asking a question which results in like a fidelity score for an item for you, because we're not really in a fidelity review. And so I don't want you to walk away from this thinking, well, Paul said I'm a 3, you know, in this item, because there's no way I could know that right now today. We haven't done the sufficient tasks needed to arrive at a score. So all those disclaimers aside, based on what you said in your comment, it sounds like there's more than just you for employment specialists. So there's at least 2 employment specialists. We still don't know if there's a team leader or an IPS supervisor, so I'd want to ask you about that. And then you mentioned that you don't meet weekly. So you have the ability to communicate with other employment specialists when needed, but not meet with them weekly. You only meet with them when needed. So I guess what I would want to ask you in a fidelity review is, okay, so how do you determine when you need to talk to other employment specialists? You say you meet with them when needed. Is that a supervisor saying, hey, Jordan, you really need to check in with everybody? Or do you only like connect when you got a problem? Or need some feedback on how to do A, B, or C. And then the third part, I would ask you, are there any scheduled meetings at all, to try to identify, if you do have sort of client-based group supervision, what is the frequency? So the target for a score of 5 is that it's weekly. So maybe you meet once a month. Again, not bad, just what your organization has decided. And then, of course, I'd want to know what, in those situations, what do you discuss? And then I'd want to know, do you cover the other employment specialists' caseloads and vice versa? Like if you're off work, do the people that you serve on your caseload just not have any services if you're off for a week or two? Or do other employment specialists kind of step in and, at least provide a minimum level of services, to the folks on your caseload, so that there's no interruption in service? And that's really at the heart of this particular item. So that's a great question you asked, Jordan, and I like questions like that in these formats, because it allows me to kind of show you a little bit, kind of tip the cards to like, what are the other questions we would want to find out in order to score this item. So let's say we're in a fidelity review and that's all you'll tell me. You refuse to tell me anymore. I know that's funny. That doesn't really happen, that people refuse, but so based on what we know, maybe is a better way to put it. You have other employment specialists. You meet on an as-needed basis. And we don't know if you provide coverage. So based on that, we might be scoring a 2. Employment specialists have the same supervisor but do not meet as a group. They do not provide backup services for each other's caseload. And the reason I say 2 is, if you think about it, so we can't score a 3, for example, because even if you had the same supervisor, you kind of mentioned you don't meet on a weekly basis, and you didn't really tell us whether you provide backup services for each other. Or is the other part here, if you're living in a rural area or working in a rural area, you didn't identify if you meet 2 to 3 times monthly. So so based on only those 2 sentences you shared, I would be looking at a 2 if you didn't provide any follow-up information. So hopefully that's helpful, A, for you, and then B, for all of us here on the line, just to try to think about how you might get at a score even with just 2 sentences worth of information. And people, please feel free to ask questions if you have additional follow-up questions based on something like that.
Yeah, Paul, I think that's very helpful, because it just shows how many layers go into each element of the review, and how important it is for all of us to take that different information to be able to kind of discuss it, to see where the different elements are to, get to that resulting score. It's a very complicated process.
Yeah, it is. And I'll tell you, when I first started as a fidelity reviewer, this might sound corny or whatever. Like I said, I wasn't really comfortable in the interviews, as a new interviewer, because I hadn't really done any interviews. And I'd done interviews and, in other forms of my life, but not as a fidelity reviewer. So what I did, in addition to having the Fidelity Manual, is I had this Fidelity Scale with me in the interviews. And so as the interviews are happening, you know how interviews go, they're kind of, you didn't want to be so robotic. You wanted to kind of be organic with it. I should say I wanted to be organic with it. So often I'd find myself, if I had 30 minutes to interview, let's say an IPS supervisor, I'd look at my watch real quickly, and I'd, be 15 minutes into the interview, and maybe I wouldn't have near enough information collected as I thought I would at that point. And so if we move to the next one, which is role of employment supervisor, we've got these 5 bullet points, and you get a point for each bullet. So at minute 15 of my interview, I might just kind of transition into, okay, so tell me, how many employment specialists are you responsible for? Okay, and are you full-time employment? Is that your full role? Because often a supervisor will have multiple roles, right? They might manage a department that includes IPS, so they also supervise other staff. So with that sort of one question, I'm really looking at, are they full-time employment, and how many employment specialists are they responsible for? So you get there, and then I might just really kind of say, how do you provide supervision to the employment specialists? And I know the answer is going to be yes. So tell me about your supervision, and they're going to say whatever they say, whether it is exactly these words or something similar. And then the next question, at minute 18 or 19 or 20, as the clock is ticking, right? I might say, tell me how you communicate with other team leaders to make sure that you're integrating your employment into their services and that you guys are solving programmatic issues. And then they'll give their answer, right? And I might say, do you ever attend a meeting for any of the mental health treatment teams? And they'll say, yeah, I do that about twice a year. I'm just making this point. The next question I would add, ever in company, your employment specialists in job development, and they might say, sure, I do that once a quarter, or if I think somebody's struggling, okay, well, do you have logs or do you have any sort of notes from that I could review? And they either do or they don't. And then I might say, do you ever talk about client outcomes with your employment specialists, and how often do you do that? And then real quickly, you got 4 or 5 or 6 questions you've asked in about a 6-minute period that'll get you everything you need to know to score this item. Because it'll be real easy for you, especially if you have any level of anxiety about any of these questions. It'll be real easy for everybody to kind of small talk in an interview setting. Until you feel comfortable just kind of asking some of these questions. And so I just kind of give this example to make sure you know that even if you don't want to sit and read the manual while you're supposed to be doing an interview, sometimes having this score sheet with you or this fidelity scale with you is kind of like a really fast forward way to help you draw a circle around the information you absolutely need to know in order to score. And again, if you remember with this fidelity scale, I have a blank one that I bring to every fidelity review, and I'll make my note right here next to this bullet point. I'll make a note, 1 FTE responsible for 3 employment specialists. And then I might make a note here that says they don't meet weekly, they meet 2 to 3 times a week, and I might put that in quotes, because it's a quote they said. And so when going back to where we started today, when you're getting ready to either write the report or contribute to the report, or you're doing consensus scoring, when Dawn or Darren say, hey, Paul, you interviewed the employment supervisor, tell us about your interview. I'm likely to say, well, I'll tell you what, I think we might want to score them a 3, and here's why. They're responsible for three people, which is fine. They only meet every 2 to 3 weeks. Or, I'm sorry, they only meet 2 to 3 times a month. They do talk with the mental health treatment team leaders, but they couldn't provide any evidence, like there's no minutes or anything like that. And it doesn't really sound like they attend the treatment team meeting more than a couple times a year. So we wouldn't be able to award these 2 items. So real quickly then, I'm kind of making my case based on my notes for what the score is. And if Darren wasn't present in the interview or Dawn wasn't present in the interview, they're really going to kind of lean pretty heavily on my notes to make this score for this item. And what I like to do in a fidelity review is at the end of day 1, just kind of check in on scoring. What have we seen? What have we seen enough of to be able to arrive at least a tentative score? And what do we still need to see? And then that way on day 2, we can request from the organization, hey, we pushed that IPS supervisor interview to day 2, and I noticed we don't have it on the schedule. We really want to, interview the IPS supervisor. Is there a way we can kind of add that into the schedule today? Then you're kind of keeping everything on track, and you're not getting to a point where at 4 o'clock on day 2, you realize that you can't score 7 items because you didn't get information. So some of this is us working together as fidelity reviewers to keep it on track, to keep things on target, and to make sure the organization knows, hey, we still haven't seen this yet. It's fair for me just to stop and ask, does that make sense, kind of doing it that way? Especially if you're in a time pinch, you'll have interviews that were booked for 60 minutes that because of all kinds of stuff, scheduling errors, mistakes, whatever, you may find, okay, well, now I got to do it in 30 minutes. And for me as a new reviewer, that was always the thing that was most, anxiety inducing for me. Was kind of like, oh gosh, now I've got to squeeze this. I feel like I have to collect a ton of information, and now I have to squeeze it into 30 minutes. Where do I go from here? And I have found that this fidelity scale is just kind of the easiest way to get right there.
Yeah, Paul, I found myself doing that sometimes as well, just to kind of, get that essential information that I need related to the scale.
Yeah, and certainly follow-up questions are all on the table, but often the way the interviews tend to go is like pleasantries, maybe a little introduction to the fidelity review process, especially if you're interviewing somebody that's not on the IPS team. So like if you're interviewing a therapist, they know what IPS is in their organization, but it may not have been explained real thoroughly to them. Why are these people here for 2 days asking us a bunch of questions? And so I always like to have kind of a 1 or 2 minute sort of brief overview of what a fidelity review is, why we do it, and kind of the disclaimer that nothing you tell me is going to get anybody in trouble, because we're not here to get anybody in trouble. We're here to just kind of understand from you all how you do this evidence-based practice, and so we can kind of compare it to what the Fidelity Scale says. And I always tell them higher scores aren't necessarily better. I'd rather you have this agency have a score that's accurate than artificially high. And most people, kind of let their guard down a little bit and are just fine, especially after that. And if, like I said, if you're in a 30-minute interview, sometimes you're talking to clinicians, they may run late because a client went long or they had a crisis. And so all the things that you think might go wrong probably will go wrong at some point for you on a fidelity review. So it's important to know, how do you kind of mash on the gas pedal with some of this stuff without feeling like you're mashing on the gas pedal, because you still want to have a good sort of experience for everybody that's sharing their time to talk with you, for sure. As we move into zero exclusion criteria, we've talked a little bit about zero exclusion, and I'm sure you know at least some of it. This is another one where the definition over on the left-hand column, it corresponds to a score of a 5. So if you do it absolutely perfectly, you'll get a score of 5, and you kind of walk it back from there. And often when I'm looking at my notes, if I'm not sure where I'm going to score somebody, I'll just start at a 5 and kind of walk it back. And if I can meet a 5, great. If I can't, can I meet a 4? Well, nope. So then I walk it back to a 3. And that's okay. There's nothing wrong with that. So the 5 is all clients interested in working have access, et cetera, et cetera. The difference between that and 4 really is that there's no evidence of exclusion, formal or informal. But something you learned leads you to believe the referrals aren't really solicited by a wide variety of sources. So let's say you go to an organization and they've got 5 teams. No, let's say 6 teams. And they have 2 employment specialists. So each employment specialist can be assigned up to 2 teams, right? So they've covered 4 teams out of 6. And guess what? You're likely not to get many referrals from the 2 teams you're not connecting with. So here's where we might say, well, no exclusion might be a 4 because they don't have the bandwidth to connect with these other 2 teams. And so they're not really soliciting referrals from everybody in their organization. We suspect those 2 teams aren't sending referrals because there's no sort of top of mind IPS inclusion or integration. So that's an example of maybe a 4 there. And then certainly like a 3 starts to shift more towards readiness. So some clients are unable to access supported employment services due to perceived lack of job readiness. And I've seen a lot of different things here. I've seen attendance policies that are incongruent with IPS principles. So the attendance policy, for example, might say something like so-and-so has to attend, clients have to attend X number of, X percent of appointments in order to be referred into specialty services. That's a real policy I saw one time. So IPS was considered a specialty service, and since certain clients didn't attend, I think it was 70% of their appointments, even if they showed up to one of their appointments and said, gosh, I really need to have a job, I'm going to be evicted, the policy for the organization said, we can't refer you to the IPS team because you haven't shown up for your appointments. So you could see where that is like a formal policy. So that'd be a 1. An example of a 3 here due to job readiness would be somebody identifies that they are interested in seeking employment, and the psychiatrist and therapist have a team meeting and decide that they'll investigate employment once the person has a clean test on a UA drug test. So that would be a readiness problem that you'd want to talk with them about. You could probably argue that that's a if that rises to the level of a policy, you could probably argue, argue that that's maybe a 1, but that'd be a good discussion for the reviewers. And the last thing I'll point out on this one is, if you notice, the difference between a score of 2 and 3 is the difference of 1 word. That first word. On a 2, it's most clients are unable to access supported employment services. For a 3, it's some clients. So you could see where, if you start hearing some things, your follow-up questions will really help you determine whether somebody falls into a 2 or a 3 on the score. So it is important to ask the follow-up questions. And if you run out of time in an interview and there's more things you'd like to learn, that's when, whenever you have the opportunity in the schedule, maybe you pull in the IPS supervisor and you say, I was interviewing a couple of the therapists and we heard some things that we just want to talk through with you. Talk to us about, drug tests that have to be cleaned before people can go work. And they'll tell you whatever the policy or the process is. And so it's just good to talk it through. And again, you don't want to react as a reviewer. You want to just kind of play it cool and just kind of ask the questions. If you're asking a question, by the way, and somebody says, is that bad? Because I've had that happen. Darren, I don't know if you've had that happen yet. But it's kind of like, well, it's not good or bad. I'm just trying to understand what you're doing so that we can give you an accurate score on the Fidelity Scale. So I've told employers too, like, at the end of the day, you've got to do what you've got to do, and you don't have to listen to a word Paul Ferris says when he shows up on your doorstep. So I'm not here to evaluate what you're doing other than to arrive at a score. Everything, beyond that score is kind of your business as an organization, and I'll make recommendations. That's part of my job, but it is up to you as an organization if you follow those recommendations. Because it's true. You'd be amazed at how many times you make a recommendation and you see it carry over into next year or the year after. And really, a lot of organizations just kind of have to have the right circumstances in order to do that, to make that recommendation into something real. So I can't stress that enough. Don't be afraid to ask questions. We're not in any sort of gotcha mode. So, they should be able to share things with us freely without any real ramifications other than a score.
Yeah, we just really focus on this as a learning opportunity for myself and the rest of the review team to really learn how agencies are implementing IPS. Maybe it's all elements all at once. Maybe some agencies are just focusing on certain ones so they can get closer adherence to the IPS model. So there is a lot of, agency choice and program choice involved with this. And we just really want to see where folks are. It's kind of like a Polaroid picture in time to see where people are at. And like you said, Paul, to make recommendations that there are ways and things agencies can do to improve different sections, different elements of Fidelity.
Sure. And we have a question, Darren, that I think is you probably want to weigh in on. So Paul says, is the IPS Fidelity Review required for an agency? And then he says, in Washington, does Amerigroup Group require a yearly IPS Fidelity Review for FCS, or who requires it? So the sort of IPS philosophy on this, Paul, is that agencies ideally would have a Fidelity Review once a year that would show them sort of from an independent perspective how they line up with the Fidelity Scale. Now, not every state sets it up exactly that way. In Illinois, for example, the Fidelity Review team is always a representative from Department of Rehab Services, a representative from Illinois Division of Mental Health, and a certified Fidelity reviewer like myself. And those certified Fidelity reviewers are a lot like you all right now on the phone. They're people who are providers and had the opportunity to become a certified Fidelity reviewer in Illinois. So we've got sort of a division of a DVR perspective of Fidelity, a DMH perspective of Fidelity, and a provider Fidelity reviewer perspective of Fidelity that does actually lead to some richness to the discussion around the Fidelity review table. So that's just how they do it in Illinois. Other places I know of have sort of independent non-state government entities who are doing Fidelity reviews. Sometimes it's an MCO, managed care organization. Sometimes it's, like a consulting firm or something like that. I also know of some places that work with the IPS Works team to provide Fidelity reviews And then Darren, if you want to talk a little bit about in Washington, specifically how you and Dawn and the state are kind of approaching the fidelity reviews, that might be good for them to know.
Absolutely, because definitely Dawn and I are a major part of the fidelity reviews and the different members that we provide incentives to contract for this. And I know some of those agencies are on the call today learning so that they can get through the training so that they can become fidelity reviewers. So we definitely rely a lot on partner agencies for that. We've also used vocational rehab staff as well, and some other folks from different departments to come in and learn more about fidelity and hopefully take that message back. HCA is very fortunate that we can incentivize contracts every year to incentivize people to participate in a baseline review, a follow-up review, and the fidelity review teams. Definitely, we have a select budget, so that does limit our ability to contract with even more folks. So, right now, there's not a requirement by a mayor group to do yearly IPS fidelity reviews. Definitely FCS is built upon the IPS model, so there's a lot of encouragement to implement those elements in your agency to start that process and hopefully fully implement all the 24 elements of fidelity. So it's definitely a process. So we've pretty much hit our contract goals for supportive employment right now. Supportive housing is still looking for some agencies to be part of their fidelity review teams. And hopefully we'll be able to do some new contracts with agencies once we know money's available for the next 2020, what is it, 2022 fiscal year funding. So definitely for folks who are on today's call, definitely there's some time to talk to agencies when the next incentive letters come out to, have a plan to participate in those contracts.
I appreciate you chiming in on that one, Darren. I always try to be cautious with questions that are Washington specific because I think
makes sense.
That's not why you brought me in.
No, but
you don't need any help with that part.
Hopefully that answered your question. If there's some additional questions about that, you can put that in the chat box, Paul. So hopefully that hit the highlights there.
Yeah, no, you did, I think. So moving along, number 7 here, agency focus on competitive employment. I think we did not mention this earlier. I was thinking we did, but we didn't. So this middle portion of the Fidelity Scale, this is really what I regard as sort of like how well has the organization sort of embraced the culture of work in the organization, because this part, the middle part, is bigger than the team. If you only showed up to review the IPS team and whether they provided good services, everybody would have a perfect score probably, because everybody does. The hard parts are like when you need others, right? You need like the executive team, you need vocational rehabilitation, you need the mental health treatment teams or the other relevant treatment teams to help make it stick. Same with no exclusion. You need all the other people that could refer to your employment program. You need them thinking in a no exclusion way in order for IPS to really be successful in an organization. And agency focused on competitive employment is no different. This is another where there's 5 components, and each component you are able to see, observe, witness, etc., gets them a point. And it's pretty simple. The intake includes questions about interest in employment. The agency includes questions about interest in employment on all annual assessment and treatment plan reviews. The agency displays written postings like brochures, bulletin boards, posters about working and supported employment services, in the lobby and other waiting areas. The agency supports ways for clients to share work stories with other clients and staff at least twice a year. The agency measures rates of competitive employment on at least a quarterly basis and shares outcomes with agency leadership and staff. And so those are the 5 items. When you go over to the Fidelity Scale, what you'll see are very simple, right? They get a 5 if all 5 are present. And this one, again, is fairly straightforward. I can tell you sort of the rhyme and reason behind some of these. The first item, agency intake, includes questions about interest in employment. 2 things about this. First is that's usually the first touch a client has in any organization is that intake or assessment. Organizations have a lot of names for it, So you might have to spend a little time understanding from an organization, when you say intake, what do they think? What's that first sort of triage or assessment level of point of contact that somebody has with their organization, and that's what you would consider the intake. The second thing about that one is it's very specific here. It says it doesn't say it includes questions about employment. It says it includes questions about interest in employment. So if they say, yeah, here's our intake, and you look at it and it has a question that says, are you employed, yes or no, you couldn't award them this item because it doesn't have a question about interest in employment. It just says, are you employed, yes or no. And sometimes organizations get a little irritated by that nuance here, especially if there's some sort of regulation or rule that they're following that says this is the question they have to have. So just, a little thing for you to think about. If you had your book out and we're all in person and I was in Washington right now, what I would do is I would have different colored pens and markers and highlighters, and you could just highlight this and circle it and write your little note on it. So I want you to think about doing that, in this manual as you go forward. The second item here, agency includes questions about interest in employment on all annual assessment or treatment plan reviews. This one takes a little getting to know the organization and their set of forms, but again, it's specifically asking you about interest in employment. Most places have at least an annual assessment or an annual treatment plan or 6-month treatment plan reviews. So we just want to kind of figure out with the agency, is this anywhere on their documentation? And they can show it to you. You can usually see it in the chart reviews. The third one here, displaying written postings. It doesn't have to be all of these. It could be as simple as a brochure. It could be a poster that they bought from Ipsworks, from the IPS Employment Center. That's fine. It could be something they had, clients who were in an art group make for them and they decided to frame. That's fine. But really, it just needs to be some sort of written posting that would be situated in a lobby or a waiting area where clients congregate so that a client may see it, and when they go back to whatever clinician they're there to see, they may say, hey, I saw that poster about employment. Do you guys have an employment program or something? Because I could use some extra money. That's really what we're trying to generate here, is sort of that almost like walk-in referral where a client refers themselves by having almost like marketing, if you want to think about it that way, available in the lobby and waiting areas. I've seen agencies that have, what do they call it? Darn it, I think it was called Potty Talk. And they had brochures for various things or posters for various things in their bathroom. And like it said at the top, Potty Talk, and then it had like a little thing that said, did you know we have an employment team? And I had 2 or 3 people's names, and it said, if you have any interest in extra money, finding things to do with your free time because you're bored, or because you'd like extra money in your pocket with Christmas coming up, call us today and we'll get you in within 3 days. It was just a neat way to kind of have something available in these. They were like the lobby restrooms. The next item here, agency supports ways for clients to share work stories with other clients and staff at least twice a year. And this can look a lot of ways. Employment recognition events. There's an agency I know of, every year they do an IPS kickoff, and this is part of the kickoff. In-service trainings, peer support groups, agency newsletters, or invited speakers at client treatment groups. So if you're an organization that has group modalities happening in your organization, you could have a guest speaker a few times a year be somebody who worked with the employment team and became employed and is working in the community, kind of as a success story. They could be, I've seen them with an employment specialist, for example. I've also seen them kind of going solo to those groups. And it's a really neat thing, for those of you that are, really keyed into sort of the mental health side of things. I mean, what a great embodiment of hope and recovery to have somebody who used to be sitting in a group like you come out and say, hey, I'm here today because I worked with the employment team and I work now and I don't, I sorted it out so my benefits weren't affected, and here I am today telling you I don't sweat it at Christmas anymore when I want to buy gifts for my family. So there's all kinds of neat things you can do. Don't view this as a comprehensive list. There's certainly no limit. And then the last one, I'll say a couple things about this. Agency measures the rate of competitive employment on at least a quarterly basis and shares the outcomes with agency leadership and staff. For this one, there's two parts to me. The first is, do they measure the rate of competitive employment? And on that note, it's got to be the rate of competitive employment for all of the clients served, not just the IPS clients. And then the second part of this is, do they share it with agency leadership and staff? So where I've seen this go very well is they use demographic information from registration, which asks things like, are you employed, et cetera, et cetera, et cetera. They take that data and they package it in their quality assurance program, which is a monthly report. So it goes out to all leadership and staff monthly. And that's about the most elegant way that I've seen it packaged, to be honest with you all. As I scroll through this, I mean, they do have the components sort of split out and they give you examples of questions on each component, like some of the other items we've reviewed. And then they go into examples for each component. So really nothing so out there in any of this that it's worth, stopping and checking in on. And the scoring is very, very simple. There's 5 items. If they got all, if you and the Fidelity review team have seen all 5 items or evidence of all 5 items, then you give them a score of 5. If you saw 4, you give them a score of 4. Pretty simple. The next item is number 8, executive team support for supported employment. It seems like a long time ago now, but do you remember earlier today I said, it's worth spending time in the beginning and finding out what they consider their executive team. This is why, because any number of these executive team titles that are listed right here, CEO, executive director, chief operating officer, et cetera, any number of these could be the person who legally is the leader for the organization. This is another where all 5 components are present in order to get a score of 5. And so we'll just walk through them real briefly. Executive director and clinical director demonstrate knowledge regarding the principles of supported employment. Here, you're not looking for them to give you, a 45-minute dissertation on IPS and all of the virtues of it. I'm happy if they have a general overview. I'm even happier if they know some key terms, but I don't expect them to be experts. I expect the IPS team to be the experts. I was at an organization one time where I had to step out for a call at a certain point of the day, and somebody let me use their office, one of the directors, and there sitting on their desk is, I'll just call it what it is. It was like a cheat sheet for the Fidelity review, and it said, here's what you say in the interview, and I had bullet points for the IPS principles, basically, on the sheet of paper. And so after my phone call, I noticed, it was hard not to notice, it was a big sheet of paper right on top of the desk. I came back, I talked with the Fidelity review team, and I said, I've never really had this happen. How do I regard this? I can't unsee it. I don't know that it's good or bad inherently. The first thing I think is, oh, well, they prepped the director for the interview. And then the more we talked about it, we thought, well, maybe that's not a bad thing. It means that there's at least they're having a meeting, they're making the director aware of the Fidelity review, why it's important. And further, they're saying, hey, you can't remember anything, you can't remember everything, so here's some talking points for you to recall. So where we left it was we didn't bring it up, and we just kind of rated this as if we didn't see it. But it was still, an interesting sort of phenomenon, and I still am not convinced it was a bad thing. I think it was kind of different, that's for sure, but not a bad thing. The second bullet point here, the QA process includes an explicit review of the supported employment program or components at least every 6 months using the Fidelity Scale. So that's pretty easy to understand and come to grasp with. Most organizations have some sort of QA process, and this gives a wide degree of flexibility, at least every 6 months, or until achieving high fidelity, et cetera. So there's a lot of ways that organizations could kind of do this. And I'll point out here too, it doesn't say what people have to measure in QA for the IPS. It just says, that you have to do it. So if they show you something, again, it doesn't matter if it's sparse or robust, it's just something. Now it does say explicit review, which kind of you know, that can mean a lot of things. Let's put it that way. The next bullet point here is at least one member of the executive team participates in the supported employment leadership team meetings or steering committee meetings. Those occur every 6 months for high fidelity, and at least quarterly for programs that have not yet achieved high fidelity. And so steering committee, while they define it, it doesn't say who has to be on it. So, you know, some agencies have employers, potential employers, community members, board members, all present on the steering committee. Others have kind of like the IPS team plus someone else. None of those are bad options. If you went to a review and you saw the IPS team plus, let's say, the clinical director of the organization, that was the steering committee, you might make a recommendation that it would be best practice to have an employer or a client or family member from, you know, somebody receiving services on the steering committee. But those would be sort of style points. You wouldn't really, they have a steering committee, so you'd still award the points. The next bullet point, agency CEO or executive director.
Excuse me, Paul.
Yeah.
Just in terms of this one, I struggle with this sometimes because I've seen some organizations who have very robust boards and a lot of integration with their municipalities and their community. But it also says the action plan part. So as part of the steering committee that they need to be looking at, you know, some of the IPS elements as part of a steering committee.
So I think yes. And so the steering committee is an IPS specific steering committee. And as such, this item does say that they would develop written action plans. So, and I think in different trainings we've talked to Darren about how in the IPS model, I think the vision in the IPS model is that when you get a fidelity review as an organization, you create a fidelity action plan to to address the items, you know, and improve your score. And I think, again, best case scenario, or maybe best practice is a better way to put it, I think the idea would be you get a fidelity review, you bring it to the next steering committee meeting and say, this is our fidelity review, here's how we scored. And either that committee or that somebody that committee sort of identifies develops a fidelity action plan that the committee can then review at the next meeting, so that you've kind of got that cycle of continuous quality improvement where you get a fidelity review. Okay, great. Let's say we got a 78. So now we're going to create a fidelity action plan. They got the stamp of approval from the steering committee. And then next year when we have a fidelity review, if this action plan goes the way we think it's going to go, we think our score will improve. So then, you know, you get that next year fidelity review, you bring it back to the steering committee, tell them how you did. Maybe you have the plan there in front of them again. So I think that's part of it. I don't see a ton of action plans when I do fidelity reviews. I see like formalized fidelity action plans, for example. I see much more informal fidelity action plans, things that are like in meeting minutes from the steering committee. So, you know, you might see in the steering committee meeting minutes, for example, that they reviewed the fidelity report and identified these 3 items that we're going to work on over the next 12-month period, rather than working on everything. You know, you kind of narrow the scope down to a small number of sort of manageable items, and that's the fidelity action plan. But that might be in the meeting minutes. It might not be its own separate document.
Okay.
So it kind of depends. Each agency is a little bit different, I guess. Some do have a real formal fidelity action plan. Others do not, and especially I would imagine too over the last 12 to 15 months. This is certainly the kind of thing that may have gotten left by the wayside, especially the steering committee. You know, just because of COVID. So we will see, I suppose, how people have been propping this up during the last year or so. But that's a good question. The next one talks about the CEO or executive director, and specifically it's looking to see how the person in that role communicates how IPS services support the mission of the agency and articulates clear and specific goals for supported employment. And it says here, to all agency staff during the first 6 months and at least annually. So I regard the first 6 months as Like if you're starting the program on January 1, within the first 6 months of the year, the CEO is articulating clear and specific goals to all staff. After that, then annually. This item is not delegated to another administrator. So if the IPS supervisor does that, it's not good enough. That doesn't come up too much. The last bullet point here, the IPS program leader or supervisor shares information about the barriers and facilitators with the executive team at least twice each year. So really you're going to ask, does the IPS supervisor meet with the executive director? If so, how often? Or the executive team, I should say. If so, how often? And this is really the content of the discussion you'd be looking for, is identifying and implementing solutions to any barriers. Let's see here. I'm trying to find that item, Darren. This one right here. And this is really the idea behind the steering committee, is that people in high-level positions can authorize changes that on an organizational level that maybe a member of the IPS team can't. So it says here, committee members may not develop action steps for each fidelity item scored lower than 5, but develop a plan they believe is manageable. So there are examples of fidelity action plans out there on Ipsworks if anybody wants to see what that looks like, but I've seen it look a lot of different ways, and there's certainly not a specific document that we'd be looking for. Sometimes a fidelity action plan is like, improve our score where we can. And if you think about it, if you're an organization that has mostly 4s and 5s, some of those are they're more difficult to turn into, like a 4 is more difficult to turn into a 5 than like a 1 is to turn into a 2. Often if you score 1, it's because you're not doing something or you're doing very little of it. So if you do even a tiny bit of it, it's a 2. Whereas a 4, the difference between a 4 and a 5, is really going from pretty darn good to pretty close to perfect. So it's just really difficult to manage that. Now we're into the services section. I know you're all kind of like, wow, yippee, right? So let me just scroll through here. There are a handful. I think there's maybe 11. I'll tell you what I might do. So I'm showing we got about 14 minutes left, Darren. I might just kind of stop at the services section and just check in with our group here, our audience, and just kind of see what kind of questions they have, or if there's any comments folks want to share about anything we've talked about today, or a wish list for things that they want to make sure we cover tomorrow. I don't want to kind of start anything new with so little time left today, and we're in a good spot really content wise. So
I think that's a good idea, Paul.
Okay, so I'll just turn it out to the group here. If folks have questions that either we haven't gotten to yet, that are burning issues for you, or you're just, you've heard everything today and you're kind of like, well, yeah, but how does it happen when you do this, or how do you do this? Now's the time to ask. And we've already got the first one. So Harrison says, how do we find out when fidelity reviews will occur? And so I feel like that is a Darren question.
That was a great first question for you, right, Paul?
Keep them coming, guys. Keep them coming.
Just like that. Yeah, Harrison, that's a good question. So every year, the HC, well, I can't say every year because we were sent out notices to agencies about the incentives to participate in the IPS fidelity review process. So we take those responses from agencies, and until we utilize all of our dollars and allocate to those agencies, then we stop. So Donna and I were very successful in the early recruitment. So we do send notices out through our Gov delivery. I also send out to my network some notices that, hey, be on the lookout for the incentivization program is starting for that. So hopefully we'll find out for fiscal year 2022 in April for dollars, so that we can start putting notices out for the 2022 cycle, which would start contracting, in August, September. maybe even July. So definitely, I'll make sure that you're on that list, Harrison, as well as everybody else, because we send that out through the Gov delivery system for notifications for heads up. It looks like this is another Darren, because it says Darren.
I love it.
Yes, through June, for me through July, because I already have one review scheduled for July, those will be a virtual format again. And this year, just because I have more reviews, I'm following the IPS schedule for a 2-day review, so it is a little bit more time intensive for the days. You're very welcome. Yeah, I now that I've gone through a 2-day review, definitely I know 3 days was like, what was I thinking? But it's already done.
We do have Rebecca asking, where can we look into becoming a Fidelity reviewer? Did you
That's
already
again
answer
with
that one?
this is that first step is being part of this training to learn about the different elements. And if this is something you'd like to learn more about, definitely contact myself or Dawn. And then when we do the incentivization again to be part of the reviews, that we just need you to make sure we have your email and you're part of the document delivery system, because that notifies about supportive housing as well as supportive employment contracts. So hopefully that's helpful.
And you are all welcome to ask me questions too. Give Darren a break here. Harrison says, what would you guys label as the most important sections to have high fidelity in? That's a great question, Harrison. So let me look at my fidelity scoring sheet. You know, the really hard part about this question is that so many of the items kind of have interplay off of each other, that saying one is more important than another really is kind of insincere almost. So I guess if you I don't know, held the gun to my head and said pick 3, Paul, I would probably pick role of employment supervisor. I think that's vital for the success of a team. Golly gee whiz, this might be the toughest question of the day. Can I pick 25 items that I think are important?
Well, Erin jumped in. She liked number 11.
Number 11. Yeah, that's the problem. Is the beauty of the IPS Fidelity Scale is any one of them alone is not as good as the total of them all. So I will go with, and this might change tomorrow if you ask me the same question, Harrison. Role of employment supervisor I think is vital. I think the agency focus is vital. And I think if you're going to get good outcomes, I was going to say rapid search. Yeah, I'll say rapid job search. I almost said job development, quality of employer contact, because I think that, if you don't develop jobs well, it's really difficult for you to get placements. So those are 3 that I would say are very, very important. Thanks for the help, Aaron. I appreciate it. Gene asks, how many Fidelity reviewers will be available for each review?
That's a good question, Gene. So I try to have 4 reviewers. So sometimes we're down to 3. I think anything lower than 3 is definitely a lot of work for just 2 people to cover all the different interviews. So anywhere from 3 to 5.
Yep, and that's pretty consistent with how it's done, I think, across the world. And it really helps in consensus scoring. If, like to Darren's point, if it's just Darren and I on a Fidelity review and we sit down to do some scoring, and I think it's a 4 and he thinks it's a 5, basically one of us has to budge, right? But if you've got even a third reviewer and somebody else says 5, then I mean, if two people think it's a 5 and I think it's a 4, I'm happy to move to a 5. I'm not gonna, I'm not gonna get out my sword and, say, darn it, it's a 4. Not that consensus scoring is like majority rules or anything like that, but I mean, the chances of a couple reviewers observing something that you didn't observe or seeing a different part of it are very high the way we do fidelity reviews. So I trust my review team, and when they say, yeah, but you forgot about this, Paul, or we heard this in an interview, Paul, that's all I need to hear. I want to give the most accurate score. Like I said, I'm not looking to win a battle over 1 point or anything like that. Since we have a few minutes left and Harrison got his dig in there, finally got the question, the stump all questions, haha. I will just I'll ask a question to the group. Is anybody concerned about giving a score and the organization not liking your score? Does that something that worries anybody? And I'll tell you, while I'm waiting for people to answer that, I've only had one scenario where an organization, I would say reacted negatively to our scoring, and it became contentious. It didn't have to be, and as reviewers, we tried to keep it, locked down. But the organization kind of took it to a contentious place. So at the end of all of it, we defaulted to what I've told you throughout the day, which is we can only score what we have seen and observed. And you did not provide this to us, therefore the score you got is reflective of the materials we had in front of us. So if you have additional, context, that the responsibility is on you as a provider to get that in front of the reviewers. And so the two reviewers that I was with on that review, we joke every time I see them at a review and we're all working together, we joke about it now. We joke, of course, it's several years later, but we joke now like, okay, let's sit next to the door. That way we give the score and just run out to the parking lot. Ha 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 ha. So that's the only time. Every other time, organizations are gracious hosts, and they bend over backwards to get us what they need, to get us what we need to make us, to score an item. So the overwhelming majority is that it's not a problem, and I would bet too that most organizations at least have an idea where they're going to score, so it's not a surprise.
Yeah, I agree. I don't think there's a lot of surprises. I've had, organizations, let me know that they didn't think they, deserved a certain score. I said, well, like you said, provide more information and I can consider that. So I always Don and I leave the reviews like we should get feedback as well on how we did. Mm-hmm. And if you don't agree with something, just, let's talk and provide more information. I've also said, well, if you can't provide the information, I can't really change the score that we provided.
Yep, and that does effectively kind of shut down any sort of that dissent. I shouldn't say dissent, that's such a weird word to use. Sorry, everybody. That does kind of shut down any sort of, negative connotation associated with a score. Because at the end of the day, you blow in for 2 days, pre-COVID, you're there 2 full business days. And that's still not enough time to really take a deep dive into an organization. Think about everything an organization does. 2 days is not enough. I'll be the first to tell you. With 2 days face-to-face, Harrison, have a good day. He's got to run to an appointment. We'll see you tomorrow. With 2 days face-to-face, you're already, the schedule is getting all moved around and people can't make it today, so can we squeeze them in tomorrow? And so-and-so had a client come in crisis, and so they can't be here for the interview. You're doing all of that on the fly, and you look at, I joke too, because you look at a schedule on day one, and it's like, oh, it looks great, everything's in order, and then by about 11 a.m. it's jacked up. You're going to all over the place, and you're just relying on the staff to tell you when and where and who you're talking with. Just because life happens, right? Especially in behavioral health or human services, life happens. We don't have the same day twice. So most places are happy to have you. They're happy to also have you go too. I'll be the first to say that. I think hosting a Fidelity review can be stressful for staff. You got to get everything in order. You got to get everything ready. You got to line up interviews. You got to do all this stuff that you don't usually do. That's kind of outside your daily business. And so I think once we leave as reviewers too, everybody kind of collectively exhales and is like, great, we have, 11 months and 29 days before we have to figure that out again. You want to give them, you want to give it a good experience for them. Like Darren said, and I totally agree with it. We want feedback too, but it really does end up being kind of like the golden rule. If you treat people square, for the most part, they're going to treat you square in return. Maybe tomorrow we'll talk about a couple other stories I know about, sort of like if it was a TV show, like when Fidelity Reviews attack or something like that.
Fidelity Island, Paul.
Yeah, there you go. There you go. There you go. Who gets voted off?
Right.
Because there have been some, I have, learned of some stories where organizations are just, they're more rigid and inflexible. And those are tough situations to handle, but as a reviewer, the best thing you can do is maintain a level of professionality, and that'll get you out of almost every scenario that's a bad scenario. And there aren't bad scenarios. I shouldn't even have spent this much time on it, because it's, like I said, it's I've had one happen in all the Fidelity reviews I've done, and I've been doing Fidelity reviews since maybe 2012.
Oh, wow.
2013.
You're like a Jedi Master, Paul.
Well, I don't know about that. Like I said, I don't know it all. But what is a nice experience is when you're a Fidelity reviewer and you go to an organization like for the second time and the third time and the fourth time, it does make Fidelity reviewing in general much easier.
It does.
So if that's the kind of thing we're looking for in Washington, I would strongly recommend it, because you can really, first of all, you can get your Fidelity reviewers feeling very comfortable and confident, but then anytime you have people who need to observe, it's a lot easier for them to observe an agency you're very familiar with too, because there'll just be a rhythm. Fidelity War, as Aaron says. I love it.
Yeah.
Okay. On that note, it's 1 after. I don't want to keep people over if we can avoid it. So tomorrow we'll just pick up with Section 3 services. And then once we're done talking about that, we're going to move right into the Fidelity review process, and we'll talk all about that. We should be great on time. So I hope everybody has a great day, and I will talk with you all tomorrow.
Thank you, Paul. Thanks,
All right,
everybody.
thanks, everybody. Bye.
All right. I don't know why I did that one. Sometimes, who knows? All right. McDonald's, huh? Crap, there's probably another meeting I'm supposed to go to, right? Oh, it could be my press. Okay, that's what I all right, so where did that email go? Okay, so I got Patricia, Jacqueline, Rihanna, Danielle, Scott. Okay, did she do that?
All right, so I gotta go in there and find hers. All right, Nina George. Okay, so make that go back. Let's do that. And then